information and data gap. Thank you all for joining, and please remember we have a packed schedule today. As you know, for those of you who are veterans of the program, thank you to all of our sponsors, and Merck Global Health Innovation Fund, Helix VM, of course, FFF Enterprises, one of the nation's leading distributors out there, the HTech Collaborative from AARP, and Metadata, the world's leading clinical trials software company. The agenda today is, as always, packed. The first hour, we're going to kick off with the overall equitable digital empowerment framework, uniting technology and diversity and bridging the digital health divide. And we're going to move into revolutionizing cardiac care and how that's looking with Bill Taranto, head of the Merck Global Fund, and Sadek Ali, the chief product officer from AcuCardio, one of the world's leading AI companies in cardiac care. And then we're going to talk about how we close the digital health divide in healthcare and get some tremendous insights from a leading executive at Takeda, and then talk about bridging women's health data gap and how there's a collaborative moving around right now in the ecosystem. And we're going to have an interview with HITLAB's own Jerry Antamano and Sama Ragbag from the women's health company Organon that spun off from Merck last year, as you all know. And then we're going to move into the last section of this hour, talking about how we can bridge those gaps. What, as we as a community, can we do to help bridge those gaps? And we're going to talk to Marissa Fire from Deep Look Medical, Ainsley Bowen, HITLAB's only Ainsley Bowen's going to talk about that. So we have a packed schedule just within the first hour. And then we've got a lot coming out in hours 2 and 3 as well. So it is really exciting. And everyone's encouraged today to use the Zoom chat box. If you could locate the chat box on your Zoom panel, we like to have interaction within our audience so that you can meet each other, greet each other, pop in your LinkedIn pages so that you can get to know each other there as well. This is meant to be interactive. This is meant to be a connectivity exercise as much as it is education and inspiration. Connection is critical here. As we've learned over the last 4 years, those are the 3 cornerstones of HITLAB's mission in terms of helping the adoption of digital health technologies. And so again, the attendee list, that just the folks who are online right now are truly representative of the digital health ecosystem around the world. We have folks from all 4 major continents, all 5 major continents rather, and we have folks from all different ecosystem stakeholders: payer, provider, pharma, employer, patients, certainly investor, digital health startup, government and academic, family foundation, not-for-profit. So even some multilateral folks here as well. So again, a tremendous audience coming in from around the world and hearing all about what is happening in digital health equity, and certainly bridging the data gap and improving the ability to capture and promote good data practices. And the idea here is that we're going to jump right into our first session with Ebony Titchener from Boston Scientific, and looking forward to hearing from her about what we're doing and what she's doing in digital health as well. And the idea here is that when we look at digital health and we look at what's happening at Boston Scientific, one of the key elements here is that we want to make sure that we're not just focusing on how patients can be touched by digital health through large direct-to-consumer, direct-to-patient platforms, or even platforms that are coming from health plans, but we also want to understand the employer framework and how employers are, in fact, touch pointing that and doing their part in that effort. So again, Ebony, great to have you on the program today. Thanks for joining.
Hey, thank you so much for having me. I really appreciate it. And I'm really, really excited to share just a few nuggets when it comes to, diversity, equity, and inclusion and digital world, right? When we think about an equitable digital empowerment, how do we unite all of this? How do we bridge that gap, right? So again, thank you so much for having me. Ebony Travis Titchener, Director of Global Wellbeing and HR Employee Policies, have spent my last 26 years at Boston Scientific, I'm proud to say. I started when I was 13 is what I like to tell people, okay? So kind of go with me on that. But no, thank you so much for sharing the slides here for me as I go through my presentation. So what I'd like to start off with saying is that as our world becomes increasingly digitized, it is so important than ever to ensure equitable access to technology and digital resources. We know the digital divide, or the gap between those who have access to the technology and those who do not, is far-reaching, and it has far-reaching consequences in terms of education, employment, and social mobility. But to bridge this divide and promote equitable digital empowerment, we got to unite technology and diversity in meaningful ways. So if we go to the next slide, we know bridging the digital divide is a challenge, and it requires solutions for accessibility, affordability, and digital skills that touch social economies, infrastructure, and technology. And there are solutions that are available by using existing technologies that provide quality, reliable, and secure access, internet access, to enable an unfettered participation in this digital economy. Incorporating diversity, equity, and inclusion into bridging this divide can help ensure that everyone has equal access to technology and the internet. DEI can help address the root causes of the digital divide by ensuring that everyone, again, has access to this, regardless of who they are, their race, their gender identity, sexual orientation, or social economic status. This can help create a more equitable society where everyone has an equal opportunity to succeed. Don't you agree? So how can we do this? Well, as we move towards this increasingly digital world, it's important to ensure that, again, and I will keep saying it, that everyone has access to this technology, but also to the skills needed to succeed. Equitable digital empowerment is such a critical part of bridging this digital divide and creating that more inclusive society. But I want us to think about some key considerations for actually achieving this. So recognizing the barriers. We know there are many factors that can contribute to this digital divide, including that lack of access to the hardware, the software, the limited digital literacy skills, and once again, the socioeconomic barriers. But it's important for us all to understand these challenges in order to address them effectively. There's also the systemic inequalities. The digital divide is not just this technological issue. It's tied to a broader systemic inequalities. When we think about poverty or racism and discrimination, to achieve this equitable digital empowerment, we've got to address these underlying issues that exist, those barriers, so that we're better at creating, for example, the policies and programs that can promote that equity and justice for all. And providing access, it's just one of the most basic steps towards digital empowerment. And it's ensuring that everyone, again, has access to the necessary technology. In many communities, accessing the technology is limited. And it's limited by the factors, as you know, such as cost or the infrastructure or the education. But we can address that, for example, by providing this access through public programs, community centers, and schools. And we know we do that in a lot of areas. But this can include providing free or low-cost internet access, loaner laptops or tablets, and digital literacy training, or partnering with tech companies to provide these devices and services to underserved communities. And building the digital literacy. Access alone is not enough. We know that. Digital literacy is critical skills in today's world. And it's essential for us to provide that education and training to ensure that everyone has the skills they need to succeed in a digital society. This can include, programs in schools, community centers, libraries, the online resources and training programs. But we need to support people in developing those digital literacy skills and in the right way, and fostering diversity and inclusion. Ah, digital empowerment is, again, not just about the access or the skills. It's also about creating a culture of inclusion and diversity. And this means recognizing and valuing the different perspectives and contributions of everyone from all backgrounds, and ensuring that technology is designed with diversity in mind. We need to do more of promoting diversity in the tech industry because, let's be transparent, the tech industry has historically maybe lacked a little bit of diversity, with women and people of color underrepresented in both employment and leadership positions. And we know that's a problem all across, but we also know we're working on it. But to promote equitable digital empowerment, it is essential to promote diversity in the tech industry and to create pathways for underrepresented communities to enter and succeed in tech careers. And this, again, can include programs such as mentorship, internships, diversity and inclusion training. By uniting technology and diversity, we can bridge the digital divide, promote equitable digital empowerment for all. But we have to be willing to do it together. We have to be willing to join forces together to create a more just and inclusive digital society. Am I wrong? And last slide, I'll end with this. It takes a village, and it takes all of us to want to be committed into making a difference. We need to be the change we want to see. And I know all of you who are here today can do just that. And so I want to thank you all for allowing me the opportunity to share my passion and share what we could be doing more of to ensure that we bridge that gap. And with that, I thank you, and I'll turn it back over to Stan.
That's fantastic, and really appreciate those inspirational words. Thank you very much. Really appreciate it.
Thank you. Thank you, Stan.
That's wonderful. And look at all the emojis. We got heart emojis. We got the clapping hand emojis and all kinds of good folks. Thumbs up emojis as well. Absolutely phenomenal, Ebony. And again, that's a great way to start off today's symposium around bridging the gap between data and information and diversity. I think that's just really critical to really start off with those inspirational words from Ebony and some great advice as well. Don't forget to enter your company or forward this to someone who you know has a startup company. We have the fall semester call for applications opened up this past week for the Fall 2023 Innovators Challenge. Remember that this includes lots of promotion, lots of evidence generation, rapid evidence generation from the lab and our scientists. And it's one of the critical elements that folks who've been a part of this program now, that's been in conjunction with New York City Economic Development Corporation, the Merck Global Fund, and many others, been one of the key attributes of helping start up a lot of companies. Groups like MediSafe, AdhereTech, and so many others, LiveMetric, have been selected by this Breakthrough Alliance Challenge for over 10 years now, and hoping that you and your company can apply. Certainly looking forward to seeing those applications roll in. And next up, we have a tremendous, again, if you look at our agenda, we have a tremendous presentation and interview with the good folks from Accucardia and Sadek Ali, and certainly HITLAB and the Breakthrough Alliance's own Bill Toronto. Bill, thanks for joining us today.
Well, thank you, Stan. I appreciate it very much. Hello, everybody. This is Bill Toronto. I'm president of Merck Global Health Innovation Fund, and I'm excited to speak to you all today, as well as our guest, Sadek Ali, and he's co-founder and COO of Accucardia. And so we're going to get a real good understanding of the company and his background today. So Sadek, welcome to the show today. So first off, we have a really broad audience of investors. We have students, we have entrepreneurs. Can you tell me your career journey? How did you start your career? How did you get in healthcare? And then how did you be co-founder and COO at your career?
Thanks, first off, Bill, and thank you, Stan, for inviting me to this. So yeah, that's a very it's an interesting question because it wasn't necessarily a very sort of straightforward journey in some ways. I started my career as a consultant at Accenture where I worked for, I'd say for the best part of a decade, right after getting a computer engineering degree. I then went into Columbia to get my MBA in the late 2000s. And after that, I ended up working at Accenture for a bit more, but I really wanted to do my own thing. So I'd say starting in early 2010, I took the entrepreneurial plunge, and effectively, if you count chronologically, Accucardia is my fifth company, essentially. The first one was, as it is the case with many entrepreneurs, not very successful. I ended up running it for about 4 years before it was clear that it was running me more than the other way around, and I wasn't necessarily running it very well. So essentially, that first company folded in 2014. After that, I more successfully launched a few other ventures, and Accucardia effectively almost came about by accident. I was in Bangalore, India, at that point, going back and forth between New York and Bangalore, because I was living in New York, and my kids and wife were in Bangalore. The kids were studying there, and I met a scientist who at that point was working on leveraging AI in some very interesting ways to look at ECG data. And the idea, as well as the approach that he was taking to analyze the data, seemed very appealing to me. I come from a healthcare family of sorts, so we go back maybe a century or longer in terms of having doctors in the family. My own father, my aunt, all of them are doctors. In many ways, I was sort of the black sheep of the family, not having gone into medicine. But when this opportunity came about, it just seemed almost fateful in some sense that, after doing everything that I did, I was coming a full circle back into healthcare, and doing something that was very interesting in the cardiology space that could make a difference in some ways in a much more scalable way than simply being, no disrespect towards that, but in terms of the scale that you can get through technology, it is just a lot larger if you are able to do so successfully than if you were in medicine as a doctor individually. So from that point of view, the opportunity seemed interesting, the technology seemed novel, and the application of it in the context of ECG, which we believe in some ways being one of the key biomarkers that an individual possesses. It just seemed to make sense to start digging into it and start investigating it as an opportunity to build a company around. So honestly, I got involved before Accucardia was a company, helped form the company and have been involved really from day one, which at this point goes back to mid 2018 through the early 2019 time period.
Well, great. That's a great journey. So let's talk specifically about the company. So what I like, it's kind of a two-part question. Can you tell the audience, what is Accucardia about? What are you trying to accomplish? And then what are some of your products that you have established that help you, meet the mission that you're trying to accomplish?
Yeah, at Accucardia, at a very high level, what we are essentially doing is leveraging the ECG signal to run a wide variety of diagnostics. Our initial sort of foundational product is something called AccuECG, which leverages the ECG signal for a very traditional use case, which is arrhythmia detection and diagnosis. And that particular product is the one that recently received FDA approval. That's the one that we are furthest along in terms of commercialization. Alongside that, over the years, we've also become strong proponents of the idea that there's a lot of interesting data in the ECG signal, both from the respect of wider cardiology as well as outside of cardiology. So we're developing products in nephrology, for example, that enable you to detect hyperkalemia, which is high potassium levels in the blood, through ECG. And we believe, like similar to hyperkalemia, there are a lot of other things that the ECG signal can also reveal. And our goal as a company is to build algorithms that can detect those diseases or those potential diseases, and leverage that to essentially become a biomarker of sorts that can be used in all sorts of different contexts, including telehealth.
Great, great. So let's talk about now the patient, the physician. How does the patient then benefit, and then how does the physician administer the AccuCardia products?
Yeah, so AccuCardia works behind the scenes in many ways. So from the point of view of a physician, or definitely from the point of view of the patient, they may not even know that it's AccuCardia doing the analytics behind the scenes. So our business model is very much in the context of licensing our software and our algorithms, either through licensing deals, allowing them to access it through an API in the back end, and from that, and we basically integrate with device manufacturers that then leverage our analytics in the context of their solutions, right? So we are in many ways powering the solutions of, say, ambulatory Holter manufacturers, right? So in the best way to think about it would be like Intel Inside, right? Like we don't necessarily interact directly with the end user of our product, but our product is powering the analytics, or hopefully will be powering the analytics as we're just starting to commercialize in the context of things like arrhythmia detection, for example, for Holter companies. And similarly for other use cases, we will integrate may integrate with the HR systems, etc. But it isn't going to be direct to consumer or even direct to physician.
Okay, so a typical monitoring company would call you to be the back end sort of analytics component, or at least another piece of the back end.
Another piece of it is more likely because they have some of their own analytics and software as well. Like what we would be doing are areas where they may not necessarily be performing as well. It could be for a specific arrhythmia, it could be for ectopic, certain areas where they need enhanced analytics beyond what they already have, or perhaps in some cases they want multiple viewpoint on the same report, right? So they would be integrating with us to get that information back into their solutions.
Okay, great. If you think of digital health, what are some of the challenges you see in trying to bring your product to market, overall in this sort of digital market that we have today?
There are several. I mean, I think from our perspective, the two sort of major ones are one, the minute you decide as a company you're going to do something that's truly clinical, you have to agree within the team and as a venture that you are going to go through the regulatory pathway. And the regulatory pathway, particularly for any devices that use more advanced analytics and AI, etc., within the context of their solutions, that is still very much in the process of viewpoints developing. While a lot has been done from the point of view of the regulatory agencies around the world, it is still a developing space. It isn't, every day the agencies are getting smarter about it, and they are providing better and better guidance in terms of how a company like ours needs to operate, and how it needs to build its initial models, validate its initial models, but then also how it evolves those models over time. So I think from that perspective, the regulatory pathway for a clinical device is one of the challenges. And frankly, it is one of those challenges that I think is there for the benefit of everyone, but it is nonetheless a challenge that needs to be understood and worked through. The other major one, particularly given healthcare, is the ability to get access to high quality data sets. Ideally horizontal data sets or longitudinal data sets over time. And that can be challenging as well because, even if you get access to data sets, one of the challenges we've had, for example, is just because a certain data set, let's say an ECG signal, is annotated a certain way, it doesn't necessarily mean that that initial annotation is correct. So when we ran a retrospective study for one of our core devices, we had to bring in a panel of cardiologists to re-annotate the data to make sure that they first agreed before our analytics was run against that. And that whole process, while painful, was very, very valuable and had to be done. But it's not always possible to bring in panels of cardiologists or nephrologists or whoever it might be to do that type of work. It becomes very, very cumbersome and difficult to beyond a certain point. So I think that's a major challenge that needs to be overcome, because a lot of times it's not just how, your machine performing or the AI performing well, but performing against whom and how well was that initial data captured and annotated that is also in question. So I think access to high quality data set with great annotation and ideally longitudinal data is also very useful, but very difficult to get in healthcare. At least for a startup, for certain larger organizations it might be easier, but for a startup, that's definitely a challenge.
Well, my last question is, because we have, we're working with the HITLAB, we have the Breakthrough Alliance and the Breakthrough One audience here. How are you working with HITLAB today?
Yeah, so we began our journey with HITLAB back in 2021. We engaged with HITLAB to do a study where we basically analyzed data from 12 lead ECG devices and compared it to data originating from the Apple Watch using our analytics engine. And we primarily studied something called a QT and QTC parameter for ECG monitoring, in ECG monitoring, and it's a very specific parameter for various potential conditions that it can evolve. And from that perspective, HITLAB proved to be a great partner, both in terms of setting up the study, but then also in terms of executing the study all the way through to working with the principals to write the reports and everything and getting it distributed. So the entire life cycle of the research initiative. So similarly, now we're planning on future studies, both with the Apple Watch as well as potentially outside of the Apple Watch use case. But the way we've been working with HITLAB, frankly, is more on some of the more forward-looking stuff, as opposed to some of the core of what we've been doing on the ambulatory side of things, because specifically with HITLAB's focus being on digital health. And I think, ultimately where we want to go as well is the ability to get a lot of the value that we drive today through clinical grade devices onto consumer wearables and the likes. And I think HITLAB is also well positioned to in some sense move towards that world, and that's where we see the best and overlap between what we are doing and what HITLAB provides.
Well, fantastic. Well, first of all, I want to thank you very much for your time today, Sadiq, and congratulations on the success of Epicardia and more continued success. For the audience, if you're not a member of the Breakthrough Alliance or Breakthrough One, as chair of the Breakthrough Alliance, I ask you to join. It's a fabulous group to be part of and networking. And with that, I'll thank Sadiq for the time today and turn it back over to you, Stan.
No, it's great. Thank you very much, Bill. And
well, thank you, Stan.
Amazing opportunity to hear from some of the leaders in not only cardiovascular health, but also artificial intelligence. And what we've seen with their program, with their platform is amazing. Thank you, Sadiq. Thank you, Bill. And just don't forget to amplify your brand and to have a bigger impact in healthcare by looking at the Breakthrough Alliance if you are an institution. And again, you can message me here on LinkedIn if you're interested in joining that, or the BT1 Global Fellow membership as well. So scan your QR codes there if you're interested, or just join me on LinkedIn and pop over any questions or comments around BTA, BT1, or this symposium. And if you have any evidence, do share it. We love to put all evidence on this program, on this platform, not just HITLAB generated evidence, but really anything that's showing the adoption of technology. We'd like to accelerate it through promoting and shared perspectives and insights. So this is really a great start to the day, first with Ebony and then with Bill. And certainly kicking off into the next session, we have Steve Winauer from Takeda to talk more about what's happening with Takeda and how they're closing healthcare's digital divide as well. So looking forward to hearing from Steve and hearing what he has to talk about here. Steve, how are you? Welcome to the program. And we're really glad to have with us today, Steve Winauer from Takeda Pharmaceuticals. And again, Steve is another one of the digital health leaders that we keep in touch with to find out what is happening on the front lines of digital health and healthcare delivery and life sciences. Steve, welcome to the program today.
Thank you.
let's start off with just a little bit of background on you and your journey and what you do.
So I lead the data, digital, and technology function for the U.S. business unit in Takeda. I've been working in pharma for about 24 years, starting out in Pfizer, and then a journey that's landed me here in Takeda most recently.
Well, that's fantastic, and certainly we've followed a lot of what Takeda is doing. Takeda is really one of the leading life science companies with what they're doing, not just on the operational level, but with Takeda Ventures and all the good things that they're building there. And provide us a little bit of context here relative to healthcare and what you're doing. How are you perceiving the digital health divide and how it's impacting patient access to essential medical information and services, and what role are you seeing your department playing in addressing these issues?
So when we talk about the digital divide, I think it's important to recognize that what in some parts of the country, we all say, well, I can go get my answers from Dr. Google. I can just look it up. I've got a computer. I can find answers. I've got the time and I've got resources to go get lots and lots of information. But taking that for granted is the first example of that digital divide. Folks that don't have access to that information or those tools to be able to understand what are the options, understand more about what's going on. So one of the things that we look to do is to try to make those resources, education resources, available in different forums so that we can start bridging and making that information available regardless of the tools that our caregivers and patients have.
Brilliant. And when it comes to this equation and it's kind of the calculus around this, data collection and analysis is so critical. And how does Takeda collect and analyze the data to identify gaps in health information or the disparities in patient outcomes? And what kind of strategies are you guys deploying to cover these gaps?
So it starts with the patient journey. And as we get data from a number of sources, like all pharma companies, we get data from a number of sources, whether it's ethnographic data, claims data, or data that we collect by way of the interactions we have with patients and caregivers. We map that along that patient journey. And we then can start to understand in each of those moments in their journey, what is the information that they don't have or that they do? And then we can see by those areas, how do we close the gap? How do we see the gap where they don't have access to an information or a therapy or something to help make a decision?
That makes a ton of sense too. So when you are looking at this, could you share a little bit of examples? Can you share some examples of successful projects or partnership where Takeda has worked to reduce information gaps and help to ensure that healthcare professionals and their patients actually have access to this kind of more accurate and more up-to-date information? That's so important.
So I think I'll call out one area. So Takeda has a program overall called OnePath, where we provide services to our rare disease and plasma therapy patients to help patients and caregivers along that journey of access to care and sustaining the care. And it can be basic services or some specifics to that therapy. That program's really, I believe, best in class. And it leverages the data about the journey. We have professionals who are talking to patients, HCPs, and caregivers with information that they can provide for whatever resource they need at that moment in the care. So we're providing them with patient resources, whether it's a video or just a mailer that will send, hey, here's how to do something like this. Can be home infusion or just sharps disposal or whatever's necessary along the journey.
That's great. And let's dive into that a little bit more too, and certainly talk about how your department is collaborating with external stakeholders like governments and NGOs and certainly different tech companies and research groups like HITLAB to address this kind of digital and informational divide in healthcare and whatnot. What kind of work are you guys doing and aligning with external stakeholders to meet these needs?
So I think the way to think about it, the fundamental is, how do I remove the friction? Because every step along that journey, anything we can do to remove the friction. So with our partners, it could be digitizing enrollment forms, or it can be understanding with specialty pharma, guys like that, or whoever, what are they see, exchanging and working as partners to understand what are those barriers, those friction points in the system, and then try to get them out.
It's fantastic. And when you are identifying friction points and trying to understand how to work with them better, and just looking at the evolution of digital health technologies and how fast it's evolving now, particularly with AI and data analytics, how does Takeda stay at the forefront of innovation to make sure that all of these different technologies are being brought in to address these gaps and drive improvements in health outcomes?
So I think I want to insert something that's core to Takeda, which is our focus on patient trust, reputation. And so as we identify these capabilities, we're looking to make sure that those capabilities align with what's going to help the patient. How do we use data in a way that maintains our priorities around trust and reputation? So what we do is we empower the colleagues in our teams to understand what's out there, and then to use it properly to help that moment in the journey. And it's about keeping that focus on what problem are we solving? What are we solving for the patient and the caregiver? And so we can apply, whether it's AI or something as simple as an automation, to help that friction.
Fantastic. And anything else you want to add before we close out this conversation? This has been phenomenal.
No, I think we've covered a lot in a brief time, but there's certainly a lot going on, and I think this will all continue to change and evolve. And it's certainly full time to keep up.
No doubt about it. Well, thank you again, Steve, for joining us today, and have a great week.
Thanks for having me.
Incredible session again with Steve there. And for those of you, again, love all the emojis. Thank you for doing that for Steve. And again, thank you, Steve, for joining us. And if you are interested in hearing more people like Steve and meeting people in person, then join us at Columbia University, November 28, 29, and 30. That's Tuesday, Wednesday, and Thursday of the week after Thanksgiving for the 11th Annual Digital Health Innovators Summit. And again, it's been going on for over a decade now. It is an incredible opportunity for meeting people, meeting partners, alliances, finding new digital health tech that's been validated and verified through rigorous studies, either HITLAB or other major academic medical centers and academic centers for digital health research around the world. And it's extraordinarily cross-disciplinary. So you'll meet folks from Columbia, you'll meet professors, you'll meet, again, folks from nonprofits, from multilateral agencies like WHO, UN, World Bank, AARP, all of the top 10 manufacturers, major hospital systems, not only from the New York metro area, but from around the country and around the world, as well as health plans, employers, digital health startups, investors, both angel, seed, as well as some ABC investor folks, some private equity folks, and a few billionaires who love digital health and attend our events on a regular basis. So hoping you can join us and just scan the QR code there. And certainly, again, connect with us on LinkedIn or email us if you have more questions. That given, we have a lot of other stuff to cover this last session, including HITLAB's own Jerry Antimano, who's going to be interviewing an exec from Organon, the world's leading digital health company, the world's leading women's health company for women's health products, and doing a lot of great stuff in digital health as well. And Jerry, take it away.
Cheers, Sam. Thanks so much. Great to be back on the program again. As Sam mentioned, I'm Jerry Antimano. I'm Senior Manager for Community Development at HITLAB. And I've got the distinct pleasure today to interview Samara Ragab from Organon. Really nice to meet you, Sama. if you could just let the audience know who you are, what you do, and most importantly in this virtual world, where you're calling from as well.
Okay, thank you so much, Jerry, Stain, and all of that team for the opportunity to be with you today. It's not the first time, but as an attendee, but it's the first time as a speaker. So thank you for the opportunity. I'm Sama Hargab. I'm heading the Middle East Regulatory Affairs organization in Organon. Organon is the a pharma company, multinational pharma company that mainly work in women health. We are working on the women health from wider perspective, including more than the reproductive health. We are looking at more diseases that impact women, maybe in a different way or disproportionately. I'm calling from Dubai, where I live, my family, and we have our headquarter of Middle East, North Africa, and Turkey region office, Organon office here in UAE. This is it.
Wonderful. No, thanks so much for joining us. We appreciate that it is a little bit later on that side of the world, but I'm sure you've got much better weather than we're experiencing over here in New York at the moment. So very jealous that you got a bit of a warmer climate over there. But we're here to sort of talk about sort of bridging the women's data gap that you're sort of focused on at the moment. We hear a lot about the political gaps and the financial gaps in the news all the time, but we'd love for you to shed some light on the current gender data gap and why it's important to bridge that at the moment.
So nowadays, as you know, data plays a crucial role in facilitating and informed decision making in public health, and to ensure the ongoing scientific progress in healthcare. Also, to achieve universal health coverage and the health SDGs, it's crucial also to have strong and dependable data to rely on. Disaggregated gender data that is mainly based on gender is crucially needed to empower health systems to uncover disparities, to conduct a comprehensive gender analysis, to reveal gender inequality and constrictive gender norms, so it's able to improve access of healthcare to women and other vulnerable groups. Also, to tailor policies to be gender responsive and transformative. Allocate resources appropriately to enhance capacity and to establish fair and inclusive health system. And the World Health Organization in 2019, they actually took a significant step to disaggregate their global health statistics by sex. This was done for the first time, and this was a great step, breaking down the individual data at all statistics of the World Health Organization to disaggregate it by sex. For decades, the women's health used to be also narrowly perceived, focusing on specific anatomical parts of the woman body, but main conditions that might impact women differently or that might impact women disproportionately were totally excluded. Also, women were excluded from clinical research and clinical trial until 1993. So all the data that we have for now are really biased against women, because the available data worldwide infrastructure were for long time based on trials and research that mainly including only men. But let me say that this is hugely improved recently in the recent years. However, it's not enough. And even clinical trials that are inclusive, more inclusive to women, they do not disaggregate data. Some of them, they are not disaggregate data based on gender. So that's why we have this kind of gender gap. And it's important, as we said, to have this disaggregated gender data to be able to reach better health for women.
No, absolutely. Yeah, no, you brought up some really fantastic points there as to, really shedding a lot of light on the importance of why that needs to be bridged at the moment. And there, as you mentioned, have been some improvements, but we're definitely not done yet in terms of really making sure that that gap is bridged. And to that effect, you mentioned a little bit about some of the biases that are involved, with bridging that data gap. Can you talk a little bit about the key challenges that you've seen and that you've read on around collecting and using data related to women's health issues at Organon?
Yeah, sure. So to have effective and accurate data sets, you have to have a clear definition. And without a precise definition to women health, comprehensive definition that takes into consideration not only the reproductive health as we used to do historically, but also to take into consideration diseases that impact women differently, or diseases that impact women disproportionately. And one important examples of kind of diseases that impact women differently is the cardiovascular diseases. And if we have like an in-depth look at this example, we will find a shocking facts actually. While third of all these deaths from heart attacks are among women, women often exhibit atypical symptoms, not same as the symptoms that we all know about heart attack. So this resulted in that 37% of women are 37% more likely to receive an incorrect initial diagnosis when presenting to the emergency room with heart attack. And women under 55 of age are approximately 7 times more likely than men to be discharged without hospitalization when presenting to the emergency department with a heart attack. So as you can see, it's very important to have an accurate definition, comprehensive definition, to be able to get accurate data and effective data. Another significant challenge, I would say, funding, because inadequate funding is in all women research is really a big challenge, and the global statistics highlights the underfunding of all women health research and generally and across the entire data value chain. And if we take an example of the biopharma, you will find only 4% of all biopharma research and development spending is directed towards female-specific conditions. So generally, this underfunding for women health research that generates specific data about women is really a fundamental challenge, and we need to work on as all stakeholders in working in health and pharma. I can see also another examples to demonstrate this lack of funding in women health. We can see it everywhere, and all over the board.
Yeah, no, absolutely. I think you bring up some really, important challenges and need some shedding light on, and we got a lot of agreement in the audience. I think you saw some of the audience virtually applauding, and some of the heart emojis come up in total agreement with you around some of the challenges that that both the physicians and the patients are facing at the moment. And hearing that sort of statistic about misdiagnoses, does definitely resonate with me. Having a mother that's had several bouts of proper diagnoses with regards to her cardio or her heart health and stuff. So really, really important points there, Sama. Are there any notable tools or tech that you've seen that are being used to enhance that sort of data collection at the minute, and that are being used in analysis within this sort of context?
So we are in a digital health symposium, so we cannot ignore how much digital ongoing innovations are playing an important role in this. And actually, when we talk about digital health, we can see the role of big data technologies, fairness algorithm in AI models to better process data in conditions that impact women, and manage the historical biases in the data. So lots can be done with the digital tools, but what we need to do is this collaborative approach, this collaborative efforts from all stakeholders to work on this and find innovative solutions using digital tools, because they are offering a lot.
Yeah, no, absolutely. We've seen a lot of these tools being used and being developed. Those of you in our audience who are familiar with the Women's Health Tech Challenge, we are planning to hold it again at the beginning of 2024. So do keep an eye out for that. There's always a wonderful plethora of different tools that are being developed for women's health tech that we are shining a spotlight on. So do keep an eye out on that. And of course, you guys at Organon, constantly, working to seek that kind of tech that's going to be making that difference for women's health on a global scale. As we sort of close now, Sama, we're always very limited in the conversations that we have at this particular event. But in closing, can you talk about how businesses and corporations at the moment can contribute to bridging that gender data gap that you're talking about, both within their organizations and in their industries as a whole, and maybe share some success stories or best practices that you've seen in different regions of the world?
Yeah, sure. We talked about the unified universal definition and how it's important to develop one. And this will bring opportunities throughout the data value chain for life sciences companies, providers, payers, academics, all stakeholders. So we're all, we need all to align on a universal definition. And in Organon, as I mentioned before, we have already adopted a comprehensive approach, and this is how we also build our pipeline based on this universal approach to women health and women health conditions. Also, we need to work, maybe corporates should do more and fund more innovative ideas and solutions. And I got along a lot of initiatives from big pharma companies to fund the startups that are working on data solutions, to empower new innovations in data solutions. And in Organon, if you are talking about success stories, we have in Organon Minette, we already launched a Femtech Accelerator program where we are sponsoring startups that work in Femtech solutions, including these startups that are working on data and women health data. Also, we have like a collaboration with UNFPA. This is the United Nations Sexual and Reproductive Health Agency that work on reproductive health, and this collaboration has one big pillar that includes enhancing the digital knowledge and data solutions with ethical artificial intelligence capabilities, as well to provide information and analytics. And finally, diversifying clinical trials. Not only diversifying clinical trials, but also work to disaggregate and analyze gender-specific data in these clinical trials and other women health research. Thank you so much again for the opportunity.
No, thank you so much, Sama. We really appreciate you coming on, sharing your insights with us. You're getting a lot of applause from the audience in the virtual emoji section. And thank you so much for the work that you're doing for women and women's health tech, both in the Middle East and also on a global scale with Organon.
Thank you so much.
Thank you. Those of you in the audience who want to connect with Sama, of course, her LinkedIn details are in the chat, so please do connect with her. And any corporates are out there, as Sama was saying, if you do want to get more involved with women's health, do connect with her. Organon is doing some amazing work, and do connect with myself or Stan at HITLAB and see how you can support the Women's Health Tech Initiative as well. So Stan, over to you.
No, it's wonderful, Jerry. And again, thanks, Sama, for joining us today. Incredibly inspiring words and just amazing advice for everybody in the ecosystem here today. And again, if you do have any questions about this, if you want any additional speakers or topics covered, either in the symposia that we have on a monthly basis or for any of the Women's Health Tech Wednesdays, just pop my LinkedIn into the chat box on the webinar in Zoom. Just connect with me and shoot over a message, topics, speakers, technologies, any companies that you'd like to see, because we look at you all, our community, to really drive the agenda for what we need to do next and where we need to focus our teaching, our research, all of our events, our programmatic interventions, whatever we're doing. We really do respect and do value your feedback on that, and certainly publications as well. And next up, speaking of just doing tremendous things in women's health, is our own HITLAB's own Ainsley Bowen, Community Development Manager here, who's leading the charge on women's health. And Ainsley has with her another leader, a technical leader, Marissa Fire from Deep Look Medical. Ainsley, thanks for joining us today.
Thank you so much, Stan, and I'd like to welcome Marissa. So glad to have you on the program today. If you wouldn't mind just starting off by giving the audience an introduction and background on yourself.
Absolutely. Thanks so much for having me. So Marissa Fair, I am a 20 plus year, I don't like to name it, medical device executive. And I've been focused a lot in the imaging space, mergers and acquisitions, women's health, before it was even popular, quite honestly. So 20 years in women's health already, and especially on the digital health tech side of things. It's really exciting, but I'm the CEO of Deep Look Medical, and we are a software technology company where we focus on imaging, radiology, and we have our first flagship product, which is DL Precise, which is already FDA cleared.
Awesome.
And commercializing now, commercializing.
Congratulations.
You always get a clearance, but you sometimes you don't commercialize. So that's the exciting part.
No, congratulations on that. And on the topic of, bridging that data gap and the digital divide, I kind of wanted to get your opinion on, how can we address the data gap in AI to ensure that machine learning models have access, to not only diverse, but also representative data sets?
I mean, I know it sounds easy, but just ask for it, demand it, require it, write it into your studies, write it into your trials, write it into everything that you're doing, especially when we talk about AI and machine learning. The data is there. There is exactly what was just said by Organon and so many other speakers, and I know it will continue to be said. especially for the therapeutic side, there is not enough data. But when it comes to AI and building new models, there is a lot of data out there, most especially in the mammography space, when you're speaking about breasts, because that is the only annual imaging screening that happens on a regular basis. So that data is there. So it sounds really simple and basic, but ask for it to be part of the work and the trials that you do. And sometimes it might come at a little bit more of a cost. It shouldn't, especially when it comes to data. But when we're looking at other like drug trials and things like that, you're looking for a different diverse set. When it comes to data on a man, data on a woman, I mean, it's the same cost of data. So just ask for it. And it's not just including women. It's including people of color, people in non-urban settings, not on the coasts. There's a lot of work that's done on the East Coast and the West Coast, and sometimes we forget about the entire rest of the country that's also incredibly diverse. In order to feed AI and machine learning models, you have to feed it data. And that data needs to be diverse and representative of the entire swath of the human planet. And it can't just be white men or even white women. It has to include all types of people, and you as a person and as a company need to specify that. There is some legislation coming down from the FDA as well that is going to require it. So that's, I think, what you just need to do.
Yeah,
Again, sounds a little naive, but
just ask, right? I mean, there's no harm in just asking, putting that out there. I mean, that's the least we can do at the end of the day.
Yeah, and find some of your, like if you're working with the CRO, tell them that's what you want. And don't go with a CRO if they're not willing to do that work for you, or or a research organization that's you're buying your data from, or you're partnering with. Tell them that's what you want, and also go to other more diverse areas. Go to a learning institute that's potentially in a different area.
Right. Yeah, no, there's, so many different ways to be able to kind of reach out and be able to, kind of request and almost demand that diversity and more representative data sets. And talking about when we're getting into AI more specifically in the healthcare space, do you have an opinion on how we can more establish transparency and trust in the data sources and models, especially considering some concerns that physicians may have about the data they are actually relying on in terms of the AI?
Yeah, so physicians have always been the source of truth, and they continue to be, and they have every right to question this. So, I want to also put that out there that everything should be questioned. It shouldn't be just a black box that everyone just assumes is good. So, they're also protecting their reputations, because most of the time, a lot of this AI machine learning is not yet at the decision support or actually making decisions for the physician. So they have every right to ask all of these questions. I think the best thing to kind of establish transparency and trust with them is to make them understand the basis of your model, understand the basis of your application, the work that you're doing, how you taught it, how you fed it, make them and understand where the data has come from, so that they see it, what was fed into it, and that, you have the gravitas behind you as well. One of the other things that's really important, and something that we focus on at DeepLook, is making sure that it's based in fact. And it's not just learning to start. So with fixed deterministic code that isn't learning, it's not changing. And it should be the base and the model for then learning on top of. So, it's code, it's lines of code like we've been using for 20 years. It's what computers are built on, and, things like that. It's fixed. It hasn't been learning. When it's fixed and you're going to get the same outcome every time, no matter what, then you can layer on AI. Then you can layer on machine learning, because you have a basis of truth. And I think that's a really important model to make sure that physicians have trust. And listen, adoption of technology in healthcare is really hard. So let's start with basis of truth. Let's start with things that are fixed and take baby steps to get there. And then when you have that truth, learn from that. And that's the way that trust gets enabled, especially in the physician community.
No, I love that, especially, you know, bringing it down to those terms where the data itself has to be accurate. It has to be truthful. And if you're building AI on top of, you know, a bad or biased data set, then you're not really learning and not really using that technology to its full potential. And kind of on that topic, so what do you think are the potential risks and challenges associated with using machine learning if the data set is bad or biased? And how do you think these issues can be mitigated besides just building it based off truth?
Yeah, I mean, you have to be very specific on what you're feeding it. And I think, like, garbage in, garbage out. And, we're living by the model of, you have fixed truth and known, like what we're doing is we're making sure that we have known malignancies that are loaded in the system, known benign, known biopsied, it's truth. So it's not just based on code, it's based on the information that you're feeding it. It is verified independently before you even get it, so that you're feeding in the right information. The risks are, you feed it bad data, you're going to get bad data out, or it's learning something, inappropriate or incorrect. And it's a big challenge. It's a big challenge why machine learning, especially, in the last 6 months is getting a little bit of backlash for the sole reason of nobody knows where that data set is coming from. So again, like I'd said before, if you point to loading it with, diversity, loading it with known truth, loading it with the right information, then the risks and the challenges kind of go away, provided that you have obviously a really good, robust model. And when you put in biased information, you're only going to get results for a small population. That's not going to serve everybody else, and it's not equitable, because you need to serve everybody with these solutions. And that's one of the points of AI and machine learning is that it kind of democratizes and makes the technology a lot more equitable, but it has to be with the right inputs. And I think that that's where the biggest challenges come from. I think one of the biggest challenges, honestly, is getting the data, is getting the correct data to feed in. And this is where universities and learning institutions really need to help companies, and especially small companies, to get this. When we're talking about, the Organons and the GEs and things like that, they have the capital to be able to spend a ton of money for these learning models and for these diverse sets. But it needs to be accessible for the smaller companies as well, because we're all going to be their acquisitions. When in the long run, most of us, the good ones, are going to be acquired and integrated into these larger platforms. And that's, a lot of the play for these AI machine learning companies. And so making sure that we have access to a lot of this information at a correct price point as well. And it's a really big challenge for AI and machine learning companies right now, especially in healthcare.
That's very interesting to know, that, it can sometimes be hard to get access to that, truthful data set to begin with. And so especially when we're talking about, layering machine learning and AI on top of a fixed data set, which can ultimately enhance physician confidence and provide more reliable results. But how do you think it can enhance that physician confidence, especially compared to solely relying on original data sets, for example?
Yeah, it makes it trustworthy. So, physicians put their reputation, they put their medical license at risk every time they make a decision. And so, normally they rely on their brain, and that's their biggest tool and, in research capacity. But, AI machine learning is allowing them to make different and better decisions, or confirming what they think as well. And so making sure that they have the trust in the data, a trust in the information, that's helpful, because then they're going to adopt it. Then they're going to push it out. Then they're going to, tell their friends about it. Then they're going to, go to a medical, college or community and conference, and they're going to talk about it, and they're going to stand up for it. And that's how technology gets adopted. And so, they're using this information to oftentimes not have somebody else make a decision for them. We're not there yet, especially in healthcare. And I actually don't think that we should be yet, because it's relatively new and everything's still learning. So we need to get to a point where they're just validating their thoughts, and then it gets adopted, and then we go into a different modality, and then you keep layering on top of there until there actually is a lot of trust from the physician confidence side of things. It has to align with their thinking and their decisions. And a lot of the technologies that are built right now I mean, they're built in a vacuum. Nobody speaks to a physician. Nobody speaks to what they want. Nobody speaks to, asking them their thoughts and opinions. And I'm not saying that, they're always 100% right. But, if you speak to 100 people and 95% of them are aligned, well, that's probably where you should be going and focusing on as well. And it's kind of verification and validation for them.
Right. And I realize that we're almost at time here. And so I just wanted to wrap up really quickly with a question on what steps can we take to educate physicians about AI, the limitations, the principles, and making them more comfortable with these technologies that will ultimately benefit their medical practice, like you were saying, in the long run.
Yeah, so explain what it is, and it's our responsibility to educate them. It's not their responsibility to find out about it. And we have to understand the physicians are set in their ways, and it's really hard to change them. So explain what it is, explain how it's trained, explain how it's been created, explain what this means to them. Is this decision support? Is this a workflow tool? Is this a visual aid? Explain it to them, and also explain that this is not replacing them. That's really important where we are right now. This is not a replacement, and bring them into the process. And sometimes that's including them, as part of publications or scientific advisory boards or your chief medical officer. Bring them along so that they can actually be your biggest champions.
I love that. Thank you so much, Marissa, for giving us your insights on this, and congratulations again on the FDA clearance. That is amazing news, and look forward to hearing more from you in the future. But again, thank you so much for your time today.
Thank you.
Super, and thank you, Ainsley, for a terrific interview with Marissa and Deep Look. As we're seeing the development and the evolution of data in digital health, we're seeing the nuanced applications, particularly with machine learning and artificial intelligence, take place in ways we never imagined. And so these points that we're seeing are phenomenal. You learn a lot more about this as well when you join the Breakthrough Alliance, either as an enterprise with the official Breakthrough Alliance with New York City Economic Development Corporation and Merck Global Fund, but also as a BT1 member. BT1 Global Fellows, professionals, executives have an opportunity to not only be on the HITLAB Hub platform, but also look at transcripts and slides and network with each other, go to events, both virtual and in person. So scan there, learn more about it. It would be great to have you in our community more thoroughly there. Now we're on the second hour of the September Symposium, and we are cooking with gas, as they say. We are excited to bring up next HITLAB's own Riley Fink, who's on the advisory team at the lab, and he's going to be talking to Kimberly Friedrichs from Channel Experience Strategy team at Roche. Again, another great partner at the lab, and certainly Priscilla Beal and all the good work she's doing at Roche Genentech, phenomenal in terms of leading the patient centricity efforts at Roche Genentech, and also chair of Women's Health Tech Initiative at HITLAB. So Riley, with that, handing over the virtual podium to you and to Kimberly.
Thanks, Stan. As Stan mentioned, I'm Riley Fink. I'm the Innovation Strategy Manager here at HITLAB. It's a pleasure to be back on the program with you all today, and I'm excited to introduce our next guest, Kimberly Friedrichs. Hi, Kimberly. Nice to see you.
Hi, nice to see you too.
Thanks for joining us here today, and please take a few minutes to just introduce yourself to the audience and tell us a little bit about the work you're doing with Roche.
Sure, happy to. Thanks for having me here today. I'm Kimberly Friedrichs. I work in the Global Digital Excellence team, specifically in the Channel Experience group. And my main focus is on defining our customer engagement strategy with healthcare professionals in the digital space, specifically also in the web, and co-creating new solutions with healthcare professionals and owning some of our enterprise solutions.
That's excellent. I would love if you could tell us a little bit more about some of those new global experiences that you've helped to develop for the healthcare professionals.
Sure, happy to. So at Roche, we really truly embrace listening and co-creating new solutions together with our customers. So we recently created a new global web experience. And before we started doing that, first of all, we looked into all of the market research that we had at our fingertips. And we knew from market research that healthcare professionals prefer a variety of content on websites, and that although Independent medical education sources are extremely important and preferred, but they also consider pharmaceutical company educational websites as an important source of scientific information. And so we also learned, well, we all know that healthcare professionals are extremely busy, but we learned just how busy they are. For example, a majority of oncologists access product information, scientific research, medical news, and even medical education during or between patient consultations. So that really shows like the types of format that we need to make available so that they can take quickly informed treatment decisions. We also know that science is increasing in speed. Content is outdated really quickly, and it's becoming more and more difficult for healthcare professionals to stay up to date with the latest research. And we know that they are really overwhelmed with the amount of information and touch points available to them. And then we started to look into our scientific information offerings on the web with this research in mind, and we decided we can do better. And so the idea of creating a one-stop shop for scientific information exchange was born. And then we started creating that global one-stop shop that contains all of our scientific data and information services for healthcare professionals in one place to really make it much easier for them to find credible scientific information from Roche when looking for it. And we co-created from the beginning. So we had a lot of conversations with healthcare professionals about how they want this experience to look like. And we learned that they want it to be as simple as the experiences that they have in their private lives, the experiences they have with social media, with Amazon, with Netflix. All those examples kept coming up. And so we created this new experience together with healthcare professionals and asked them, first of all, what would they look for? Which content did they most value on a pharma scientific website? And we started to combine all the content that healthcare professionals said they wanted from us in one space. And then we paired it with an exceptionally user-friendly experience. We really looked into also what are other industries doing to provide a wealth of information and content in a personalized way, in a user-friendly way. And so the new experience that we designed actually has a search-first approach, so that you can quickly type in and find what you're looking for. And it also has a social media feed that allows to browse what's the latest, what's new from Roche in a specific disease, for example. It also features those content types that healthcare professionals they said they wanted most, including clinical trial information, publications, for example.
That's amazing. I myself started in physical therapy, so previous healthcare professional here, I know that you emphasize co-creating and really engaging with those stakeholders. I know that I always found if someone brought me food, I was more willing to engage with them about a new technology or technique. So what are some of the ways that you engaged with those healthcare professionals or were able to reach them so that you could really involve them in the co-creation process, as you've mentioned?
This was actually all virtual from the beginning, so no food involved, but we found that there was a high interest from the very beginning from the healthcare professionals who embarked on this journey with us. They really also enjoyed being part of a multidisciplinary panel and being able to exchange also with peers in different areas to hear from what their needs are. And we did also notice that there were quite similar needs, right? So we set up this multidisciplinary panel of healthcare professionals from around the world at Roche that can be engaged to co-create new solutions and to obtain feedback on ideas and on prototypes. And even before prototyping, we met with the panel and asked them a few open questions, including, when looking for scientific information on the web, what is it that you do? And what do you expect to see on a pharma-owned website? And they were really, really collaborative, really excited also to be able to input into that new experience. And when we shared a really early prototype, so we really did this co-creation process. We shared a really early prototype with them in individual interviews then and testing sessions, and listened closely to their feedback. And we heard a lot of feedback, and then we made a bunch of changes. For example, we had initially quite an amount of navigation items. Of course, internally, a lot of things come up. Oh, we want this and this and this and this to be included. And we had our assumptions. But then after speaking with healthcare professionals, we reduced these down to only 3, because the feedback we received that was in some cases the naming conventions didn't make sense for them, or multiple categories from the early prototype didn't really resonate that much. So we really reduced it down to those navigation items that were matching their most wanted content types from us, and everything else is just searchable via that search field. So making it a really easy experience and an easy navigation that is much clearer for them to navigate.
Yeah, that's amazing. And then you describe a multidisciplinary team. So what are some of the various fields with which those healthcare professionals, or what type of healthcare professionals were involved on that multidisciplinary team?
Yeah, we had a variety. So mainly digital savvy colleagues from areas, really multidisciplinary areas. So oncology, ophthalmology, neurology, we representatives from all those areas, specifically also where we have content to share.
Excellent. And so you talked about some of the ways in which you gained feedback from those professionals in terms of searchability, ease of use, kind of giving them a frame of reference with, Amazon Marketplace, or, some of those other technologies that they're more familiar with. Is there any other one insight that maybe you were surprised to learn that was so important to these professionals that you didn't think was going to be something that was that important going into it?
I think one of the things that we learned was really that we sometimes had the assumption that the needs for finding, searching scientific information might differ across disciplines, right? But we did identify that there were actually 3 distinct mindsets of all healthcare professionals across all the disciplines from all over the world when searching for scientific information. And that was a great learning, because that helped us build the site in a way that makes sense there. So those were 3 key mindsets that we identified. So the first one was I just want to stay up to date in the field of my specialty, and therefore I just want to browse what's new. So just staying educated and updated. The second one was I have a patient coming in a few minutes, or even sitting here in front of me, and I need to find a quick answer to a very specific question that will help inform my treatment decision. And the third one is I want to engage with peers and learn from peers and build my reputation. So those 3 came in from across all disciplines. And that was a bit of maybe a surprise, but maybe a confirmation for some that these needs don't differ very much across disciplines, but they're very similar. I hope that helps answer the question.
Yeah, no, that's amazing. That's sometimes you go into it expecting one thing and something new rises to the surface. So very interesting to hear about. And then I'll leave you here with this last question. It's very simple. Now that you've got this new global web experience, what's next?
Well, for this new experience itself, of course, continuous iteration and improvement. We really started in an iterative process, and we are keeping an eye on the analytics, heat maps, and embedding more and more voice of customer elements to really understand how we can continue to improve, not only for the website, also for the content. And we're also regularly engaging with healthcare professionals to understand what is missing in terms of content services, and what could we do to improve the experience even more. Some of the ideas that we're looking into at the moment include interactive content, enabling more of those peer-to-peer exchange elements, because that was one of the key needs that was identified. And it also integrating with some of our core content management and approval systems as well, which will help us automate more the population of content on the site that will ensure continuous fresh content flow, but also increase some of the operational efficiency around it. And beyond the website itself, we're also working on scaling this approach enterprise-wide, right? But bringing simplification to other areas as well. And working on integrations between this global one-stop shop and our local channels to enable really seamless user journeys enterprise-wide that really lay that foundation for omni-channel customer engagement.
Wow, amazing. Thank you for sharing everything with us. And thanks for taking the time to join with us today. Your information is on LinkedIn. People can follow up with you, and we look forward to having you back on to share some more insights. And thanks again for your time.
Thank you for having me.
All right, with that, Stan, back to you.
That's great, Riley, and thank you, Kimberly. Just a tremendous interview, and looking at all the good work that Roche does around the world, it's important to understand some of the nuances that Kimberly brings to the forefront here. And that's a big part of the program, not just here today at the symposium, but also at this Innovator Summit, the 11th Annual Innovator Summit that we're having the week after Thanksgiving, November 28, 29, 30, Tuesday, Wednesday, Thursday, at Columbia University main campus, the largest theater on campus, the Lerner Theater. Would love to have you there, but that's another part of what happens there. It's that idea of shared perspectives, of being able to not only have education, but also inspiration and connection. And so just scan there to get your tickets, and looking forward to hopefully seeing you all in New York City when it's just absolutely lit up for Christmas and the holidays, and certainly love to see you there. We have on this hour coming up again now, we have a phenomenal presentation coming up from the executive director of strategic data products, right in line with the topic today around bridging the gap between data and information. Gunjan Agarwal is going to make a presentation here today on how this is being done in life sciences with precision data and empowering folks through that, and not just revolutionizing the insights that life science companies can pick up with that. So again, Gunjan, good to have you on the program.
Yeah, thanks, Stan. I'm sharing my screen.
Okay, great. And your screen is good.
Okay. Hi, everyone. This is Gunjan Agarwal. I'm Executive Director, Data Strategy and Marketing Data Solutions at Novartis. And a disclaimer that all the opinions expressed in this presentation are mine. So pharma industry generates a lot of data, okay, around the HCP, around the patients. And broadly, I have classified the data into the 4 categories. The data here you see is first-party data, the personal information, promotion, the non-personal promotion, the third-party data set. In the ideal world, we assume or we wish for, I call it like a Barbie movement, that all these data sets are very well connected to drive their true insights. But that's not the case. In the realistic world, the reality is very different. The connections can be classified into 3 categories, which are very strongly connected. It's a mid-level, tightly knit, and the third one is more superficial, not well connected. And that's when we say connect the dots, generally connecting the dots, instead of that, I try to use the word augment the dots, strengthen the dots. And for that strengthening and for the more connection, we need a right data strategy. But before we get into the right data strategy, the things become more complicated with the external factors which happens outside. So first is data blocks. Because of ultra rare diseases, patient reach outs are difficult. Evolving privacy regulations. We all know about GDPR, CCPA, but state-wise regulations keep coming. The third-party cookie deprecations from last few years, what we are seeing there, and now by 2024, their Google plan is to deprecate. There is going to be a huge impact on how do you augment the dots. With all IOC privacy changes, it's not easy to measure the performance very smoothly now. With that, we need to all step back and understand that which dots are more critical for our industry, our business use case, and how do we strengthen that? How do we augment that? And for that, we need a data strategy. But we have the strategy, connected data strategy, we call it as C343. 3 is the 3 different data types, first party, second party, and third party. And C3 defines the data strategy has to be compliant, comprehensive, and credible. With that, these 3 dimensions, you can have a connected data strategy. Compliant, we all know about privacy regulations, especially in the pharma. The data has to, what you bring on it, how do you connect it, has to be really compliant. Comprehensive, what exactly is the coverage and how well connected it is? Can we connect the claims data together to increase the coverage? Can we connect the claims data with the lab data? And how trustworthy that data is, how credible it is? What is the, let's take an example, especially on the third-party data sets. If you have social media data, it's not going to be ever complete. Then based on that certain portion, how you can build your AI algorithms and make it more better, how credible that is for the algorithm to give a true insights is a question mark. Now, to have that to do the precision marketing and to enable the C3 data strategy, we need certain things, certain questions to be asked with us, and to make sure that we consider these nuances while coming up with a perfect data strategy. First is identify and prioritize use cases. What happens is, if you have a use case right now and we might not have the data, we immediately take a decision that data does not exist, let's drop it, let's move. There is a big time strategy required there, that even if the data does not exist in a manner which can be consumed by that algorithm or by a use case, how we work on that 6 months or a 1 year of a roadmap to collect the data. And then what is more important, a lot of money spent on it, on the insights which does not deliver the right ROI. But how many times we calculate even the data ROI? Now, when we talk about this journey of right data collection, the tagging plays a very important role. If you have a launch brand, how we are connecting the, doing the right tagging, what is the most important factors? That is where the data teams, the analytics teams have to partner with the tagging teams, which are generally the digital teams, to make sure that we start collecting, which keep building over the time. It is not going to be the perfect on the day one, but that's a journey. We have to take it with the tagging. With the CDPs in the place, having an unknown to known itself is a very big use case, because most of the pharma side does not have the login. So that's where the tagging journey is very important. We use a lot of third-party data sets generally in this industry. We need to reevaluate those agreements, the data usage agreements, the file agreements, because there is a possibility our agreements are restricting us to get the data, especially the second-party data, at that granularity which is required to take more insightful decisions. Align our MarTech strategy with a data strategy, because MarTech strategy, how we have a marketing automation tools, the websites, the A/B testing, the customer data platforms, the data feed into it to enable any real-time orchestration, but the data also comes back and keep improving so that the next best action can become better. And that is where the marketing teams, the IT teams have to work very closely with the data teams. Recruit marketeers with the data skills is very important, because if marketeers if they are not utilizing the full power of the data which exists in the organization, we will never achieve the precision marketing. There is a stronger partnership required, but if we have our marketeers with the data skills, it's always the better. And then how do we need to increase our coverage with a connected data strategy? As one of my colleagues says, the data is always like a Swiss cheese, which are with the holes in it. How do we fill that holes? It's never going to be the perfect, but continuously scouting the market, very much up to date with the data vendors, help us in that connected data strategy. Either you stack your claims data or connect your claims data with the lab data, with the consumer data, so that you can actually create a complete longitudinal journey. Now, as we talk about the stacking, I would like to live with this approach of how does the data tokenization and clean room comes together to actually enable the connected data strategy. Tokenization generally is more of an encryption so that it's not easy to re-identify. And the clean rooms are primarily used for the activation of digital campaigns. But together, they are very powerful. The data tokenization can help us in tokenizing all the claims and other information. And in the clean rooms, you can stack it. And from there, the marketing agencies or the marketplaces can pick up that data and run the campaigns. So the crosswalk, the hybrid approach, not just having tokenization and the clean rooms, make it very powerful for the connected data strategy. With that, Stan, I will pass on back to you.
That's fantastic, and really appreciate the detailed and thoughtful treatment on such an important topic. So thank you very much for presenting this today, and looking forward to seeing you again soon. That's wonderful. A tremendous round of applause as well to see the cartoon emojis coming up from the bottom of the screen. as the HITLAB audience is really appreciative as well. And again, I think the day is winding through. We're halfway through the September Symposium, which is hard to believe. Ainsley and the team have put so much time and effort putting this together. It always goes by so fast. And we're looking forward to our next session with HITLAB's own global director and chairman, John Hammett, and he'll be interviewing Anita Chu Lee from the AWIS Association for Women in Science. She is the chapter president and a board member of AWIS. We're looking forward to seeing this and hearing more from John and Anita in putting this together. But I think one of the things that we look at when we talk about bridging the gap between data and information, we're constantly looking at new models, and not just new technical models. A lot of what we have to do in unlocking these insights and data-driven decision-making is we need to be able to understand just how these are working. We need to understand the politics behind them as well. We need to understand the equity that's driving these, and we certainly need to understand the efforts that people are making toward putting these together. And it's never easy when, as you all know in the audience, certainly there's always an issue around this and how it's put together. And that's something that we're always looking at as an offering. And so with that, again, John and Anita will join us here, and looking forward to hearing from them. The idea is that we have today an open chat box, so please do make sure you're putting in. I see Kat Jong already introduced herself, one of the HITLAB's community members. It's good to see Kat. She's joining in from the coastline of Washington State, and do connect with Kat Jong, MD. She's in the chat box there messaging everyone. And there's Anita. Hey, Anita, how are you? Good to see you today.
Hi, Stan. How are you? Good. We're doing
Good.
well.
And I know we're just waiting for John to get his camera going and everything. But Anita, if you could just start off and give the audience a little bit of background on yourself and your journey.
Oh, okay. Thanks. Yeah. Yes, I am a pharmacist by training, and I have been in healthcare for over 20 years now. I started in community pharmacy, and then did my clinical practice in large healthcare systems, and then later on moved to biotech and pharma. I would say every transition in my career has been very exciting, and it's been driven by my two passions, which is combining science and technology to improve global healthcare outcomes. So in my last role, I was able to really fully combine the two as the scientific communications infrastructure lead at BioMarin. So I focus on operations and technology implementation for scientific content development. Currently, I'm going through a little bit of a spin-off in my career right now, so it's been very exciting. I am a board member for AWIS and the president for the Palo Alto chapter, which the organization itself is a 50-year legacy empowering women in STEM. We have 30 plus grassroots chapters and over 100,000 members nationally. I also consult health tech startups in my discretionary time, drawing on my extensive healthcare background. And so thank you, HITLAB, thank you, John, thank you, Stan. I'm excited to be here today to share some insight on this very exciting topic from a scientific communications and medical affairs perspective.
No, that's super. And again, for the audience watching this, people all over the world, please be sure to link in with Anita. Her LinkedIn link is actually in the chat box for all of those on Zoom. And for those watching on YouTube or other platforms, just jump over and take a look at just Google Anita she'll be online with the Association of Women in Science. So Anita, this topic is obviously focused on data-driven decision-making. Tell us a little bit about how that framework has factored into your career and where it's really come in most handy.
Yeah, I would say this has been very, significant and through my whole entire career, in pharma and healthcare sectors to really drive decision-making. So when I was practicing as a clinical pharmacist, I made medication therapy recommendations using evidence-based medicine. So really it's a practice of individual patient care by using extensive research, right, found in randomized trial, metadata, meta-analysis, systematic reviews to optimize clinical decision-making. So it really allows a clinical pharmacist to answer clinical questions with accuracy, extending, the role of beyond just dispensing medications as a pharmacist. It also really allowed me to analyze physician orders to make sure that the patient is receiving the right medicine in the right dose for the right diagnosis at the right time, and also at the lowest possible cost suitable. So again, the whole concept of using evidence-based medicine is that a clinical pharmacist can recommend therapeutic changes, optimize antibiotic choices or adjusting doses, and it can help with detecting drug-drug interactions, adverse drug events, and preventing polypharmacy and promoting medication compliance. Now, switching gears, moving into pharma setting, I use data to make informed decisions on operational efficiency, workforce optimization, financial decision-making, strategic planning, innovation and technology adoption, performance monitoring, change management, optimizing scientific content development, and a whole lot more. So data is very important.
Anita, this is John Hammett. Can you hear me?
Yes, I can hear you. Hi, John.
How are you? I've been lurking here in the background because my camera has been having an argument with the browser, and the browser won, and the camera is now laying flat on its back, black. So,
well, you look great as Stan.
So thanks for that very good perspective. I'm curious about how data accuracy and integrity and dashboards kind of come into playing the role you've just described, because in the world in which there are so many therapeutic choices and so many ways of trying to determine useful outcomes from therapies, it almost cries out for an assurance that the data is accurate and highly credible, and more importantly, you've got a dashboard that gives you quick access to it.
Yes, that's a good question. I'll share the perspective of your question from actually a scientific communication and medical perspective, because the data that I will be referring to is actually publication content that I actually use in order to make dashboards when I was at BioMarin. So again, everybody keeps saying data is just as good at what goes in, right? To ensure accuracy and integrity, it really starts with high quality data. So how do you get high quality data? So when I was working at BioMarin, the data that we collected actually comes from our various different publication management softwares that we use for development and management. So standard process and training were actually put in place to ensure that the right information is collected and, most importantly, entered correctly in order to help with the integrity and lessen the cleanup process. So once it's collected, so quality assessments and cleanup must be done to decide what actually goes into the dashboards, and that's based on the business objectives that we actually define before creating the dashboards itself. In order to protect the security of the data, we also have to decide who should have access to the data bank and who from the IT governance folks that we have to work with in order to be compliant with using the data and putting it into different places, et cetera. So each dashboard itself is very unique because it really depends on who the audience is and what type of information there is that we're going to be putting in there, whether it be published or unpublished data. So we have to consider copyright rules that are involved, external versus internal audience. We have to consider what type of access and what type of level of viewing and what type of information that they're allowed to actually see. And then lastly, we use ongoing training processes to ensure that most accurate and up-to-date information continues to feed into the data bank so that we can actually present in the dashboard the most accurate information. So we do also employ quarterly reviews of the data bank to make sure that there is actually no breaks or data is feeding into the dashboard correctly. And I would say, like, lastly, maintaining good documentation throughout the whole entire building implementation process is something to really keep in mind to maintain the trust in the information that you actually display for visual decision making.
So that was an extraordinarily good word picture of how this all works. And so thanks for that. But one of the things I'm curious about as we kind of run down to the end of the time frame here, what kind of challenges or obstacles have you faced? And I'm wondering specifically about maybe the cultural ones. You know, we live in a world where we're not all the same. I grew up as an engineer. If you can't measure it, you can't manage it. But over time, you learn also that intuition is an important part of decision making. And so when you're putting those kinds of rigorous rules and processes in place, how do you overcome, you know, the challenge of kind of personal biases and cultural perspectives?
Yes, there is a lot that went into it. So obstacles faced are actually very common. Again, you know, when you think that you have all the data in the world, you wouldn't actually think that it would be that hard to transform them into actionable visuals for decision making. However, it is quite quite a process in order to, you know, speak to all the stakeholders and making sure that everything is in all the right places. So access actually at the very beginning, to gain access to the actual data that is in the data bank, it was very, very, very difficult. So we had to navigate through security and compliance, work with our internal IT folks to be able to really just get they don't want everybody in there to get the information and things like that. So that was very time consuming, but worthwhile to actually venture down that journey. Then later on, you have to identify the right teams to manage this access, and then also address all the restricted issues if there were missing data or restricted data. And then also encounter different obstacles into securing the access after it actually leaves the database, and how you're actually going to use it into your dashboards to make meaningful use out of it. So all of that, after the access to data has been identified, we realize that there's really no singles. Then we realize that there is no single source of data. So then we have to identify other places where we can actually find the data to supplement what we needed in order to meet the business objectives. So lots of devising of strategies and lots of meetings, making sure that, you know, everybody that should be involved is involved, and no you know, arching of putting more people in there that didn't need to actually see the data to have access to it, and then putting all the different restrictions to make sure that we protect it, you know, secure it, and then also, you know, ensure that validation and cleansing of that is all done. So at the very end, really, to overcome it, you have to be making sure when you're actually implementing is to find the right internal IT governance group that is going to be helping you. And if you're going to be working with a vendor, you have to be able to identify the person that is on the vendor side that will be able to give you the right information to overcome some of those challenges. So, and after all of those things are all worked out, you'll be able to significantly streamline the process and achieve the data that you need to meet the business objectives that you're trying to, you know, obtain.
Well, thanks. That's a great cheat sheet for how do you find your way through the woods with all of the distractions and threats of getting to the goal. We're going to have to wrap up and pass it back to Stan, but I'd like to end on first saying thanks for what you're doing in AWIS and specifically ensuring full participation of women in STEM, because that's an important agenda. And thanks for finding the time and the energy to do that. And secondly, I understand you're an advisor at Stanford Medical Catalyst, which has got a focus on pediatric medicine among a number of different players. And that's also a very important agenda. So thank you for being energetic enough and have enough time to put your energy not only into the work, but more importantly, these additional agendas that are making a difference for all of us.
Of course. Thank you, Stan. Thank you, John.
Take care. Back to you, Stan.
Super, John. Thank you, Anita. Wonderful to hear from you, and just, you know, really appreciate all the years of experience you bring to the table here at the symposium between Bob Moran and Scripps and all of your academic work at the University of Arizona. Very impressive background. Thank you. And with that, remember, women's health at the lab is not something that is put on display once a year, once a month because of a a program here or there, women's health is one of our core motivating factors. The staff and the researchers and the global fellows and the scientists at HITLAB are working every single day tirelessly to help not only find the most efficacious technologies in women's health that are driven by digital backbones, but also prove out and then disseminate those technologies to the global health ecosystem, whether it's through FDA studies or whether it's through smaller, more rapid studies. HITLAB has been absolutely passionate about women's health going over 10 years now with the Women's Health Tech Initiative. One of those programs in the Women's Health Tech Initiative is Women's Health Tech Wednesdays. Do sign up, subscribe to Women's Health Tech Wednesdays every Wednesday from 12:30 to 1. This semester's seminar schedule for the Wednesdays is completely packed. We are booked between now and just before the holidays. So really looking forward to having you all join us there. It's a great crowd, much like this, open chat box, a nice way for everyone to meet each other and listen to leaders in women's health, tech, and venture. We have nothing but the best startups and the most preeminent women from the Healthcare 150 that we're aware of, certainly. If you have ideas, let us know who else we should be talking to there as well. So again, we're winding into our winding down the second hour of the symposium. And we have two of the most brilliant people in the digital health ecosystem and just amazing folks as well. One of our global fellows, Zina Manji, who has led digital health regulatory discussions now for years, almost a decade, coming from her experience on the manufacturer side, working with a top 10 manufacturer, and now also leading regulatory affairs for a very hot digital health company, Loom, as well. And we have also with us Joe Dustin, who is one of the top executives at Metadata. Again, you all know Metadata, the world's largest clinical trial software company. He was one of their top executives for well north of a decade, really helping bring that company into the front of the pack of digital health and electronic data capture in clinical trials. And now the vice president and general manager at Medable. So really happy to have Zina and Joe joining us here today. Zina, the virtual podium is yours.
Excellent. Thanks so much, Stan, for the introduction. Always exciting to be on the Symposia Day. And welcome, everyone. I am so excited to have Joe join me today. I first met Joe as part of COVID cohort in the digital health series classes through Stan at Columbia Business School. So Joe, it's so exciting to be with you here today. And we're going to be talking about clinical trials. And Joe brings with him a wealth of experience in this area and focus on data and accuracy of data and the right type of data, but as well as organization of clinical trials. So Joe, over to you on introduction and some of your introductory thoughts.
Oh, thanks, Zina, and great to see all of you here at the symposium. I always love coming to HITLAB and coming to Columbia to speak to everybody. Stan, great to see you. We got to get together soon. My name is Joe Dustin. I am the Vice President and General Manager at Medable. My focus for the past 20 years and continuing to be is on the patient experience. I would say that I'm leading a team that deals mostly with what we would call electronic clinical outcomes assessments. So questionnaires and capturing the patient voice in a clinical trial. And as the modern day comes to what we're trying to capture, what's happening to a patient in a clinical trial through investigations onto drug approval, is really capturing the subjective voice of a patient through what they think they feel and the objective voice of what their body is telling us they feel through wearables and sensors and various digital endpoints. Put that together and we have quite a pathway for quite differentiating claims and also other benefits in speed and quality and just discovering things that couldn't be done before in a clinic setting. So this is the version of what we believe will become what decentralized trials is sort of promising, the idea of bringing research to people where they are, which would improve diversity in clinical trials. It would improve recruitment to go faster and hopefully shorten the duration of trial times. Because as we will talk about, the number one thing on most pharma manufacturers and their clinical R&D teams is speed to market and speed in general, especially in an economic downturn. So that's what's on their mind today.
Yeah, absolutely. And I think especially when you're trying to merge the right type of data with the right type of technologies, commensurate with the patient and the usability of that data, and how do you evaluate those outcomes. So as you're trying to organize these trials and eventually get to that outcome and the speed to market, of course, the trial needs to actually come forward with meaningful data. So what's your key aspect in terms of, in your area, what problem that you're trying to solve?
Yeah, so I think there's two main problems today that most companies are looking to solve, and a lot of supporting companies, an ecosystem of suppliers, vendors, and partners and whatnot that are there to try and help. Because we all know in most drug, device, other manufacturers of therapies, they can't do it alone, right? But overall speed to starting a study is probably the number one thing that most teams are thinking about. Now, the idea of decentralized trials and changing the way clinical R&D is done, and not so much in the lab, but actually getting the trial out there, writing the protocol, pushing it out to patients, finding those patients, and then conducting the study. They want to shorten the overall time of the entire study. But the problem is, and when I was running clinical innovation at Bristol Myers Squibb, this was a big topic, is the incentives for how people move are different, and they're sometimes misaligned. And most people are incentivized to what they can control, which is get it started. Not many people are incentivized to what happens at the total end, because a lot of people won't be there at the end. It's just a longevity thing. Some of these trials go on for a long time. But so trial startup is big. And so a lot of companies are working there. But then once the trial starts, it's really the second thing that people are really thinking about is clinical trial matching, speed to recruitment. And this is where a lot of the talk around AI and in clinical trial operations has a significant play, I believe. There's also a play for AI in building stuff to get the startup faster, but also once the study's out, finding patients, using EHR data to match them, the use of real world data and various methods to aid in the ultimate data collection downstream. So finding patients, matching them, using those large language models to actually parse through inclusion criteria through actual data in a hospital. It's becoming game changing right now. It's not brand new. There have been companies doing it, but now it's becoming way easier to do it now. And so it's very, very interesting. So it's speed. It's all tied to speed, but those are the main problems that we have. So it's speed, quality, and compliance is sort of the top three things that are on their mind.
Yeah, that's really insightful, Joe. And you mentioned AI, and there's a lot of talk about AI and automation of processes. So when you're looking at speed, as you mentioned, and optimizing those processes, especially when you're trying to get the starting point, what's your thoughts on how AI and automation can be used in optimizing those processes specifically, given where we are in our knowledge?
Yeah, it's important to differentiate between, the word AI is thrown around quite a bit. And especially in the past year, I will admit, when I was, Stan had mentioned at one point, I was at Medidata for a long time, great company. They hired a data science team so long ago before this was cool, right? And I would go to the side and say, hey, what are you guys working on? And they would tell me what they're working on. And I didn't really get it. I knew it was important. There's a lot of math and a lot of things that they were doing. And then when the ChatGPT came out, it's like, oh, I can touch it. This is what you guys have been working on. And you could touch it, right? But there's a difference between generative AI and just better automation. And so a lot of what's happening in clinical trial operations is more automation than it is generative AI, right? What's happening in companies that, sponsors, companies that I've worked for and others, they're implementing this in-house to search. They're training these AI models for clinical R&D on all of their internal documents, on all their biomedical literature, on all their data sets from their trials, on all their protocols and how they're structured, on data on their metadata repositories. All these things are happening. So that what I've heard from folks that are in pharma now are like, they're using this internal tool now to query stuff that would take them hours or days to find. And now they're able to complete their tasks much faster, which is also part of the burn through the timing thing. It's not just building a study with a vendor and building a database. It's all the internal churn of stuff that you can't find. So just that alone is helping them to automate things that were before very manual and they just couldn't find it in the first place. They're creating bots to automate, classifications of files in a trial master file. They're using bots to auto build studies from a standard definition of a machine readable protocol. Protocol automation is becoming a thing right now, where we can read the protocol, we can write the protocol, we can interpret the protocol. Oh wow, think of and then we can send it downstream to start setting up systems. That's the part. We tried this 10 years ago to try and set up downstream systems with various automation and mapping tools. Now what's happening is it's happening, but the mapping doesn't really exist. It's auto learning how to do it, and using more standards that have been put out in the industry. So those are examples of automation where that stuff coming us together. The generative side, I think, is really, I would almost akin that to a recommendation engine. Like, think about Amazon. You buy a lot of things and it tells you might like this. What happens when you're building a study and it says, hey, you're building a study like this in a phase 2 oncology study. You've also used this in the past. Others like you are using these questionnaires to determine these outcomes, and others are doing like 5 blood draws, not 17. So like, it's giving you kind of data that it's not generative, but it's generating feedback for you in that way. So
yeah, that's interesting. Maybe there's a way of getting to best practice a little quicker in terms of what's being used. So when you talk about, you started off by saying one of the key aspects is the slowness that you're trying to solve. So when you're looking at potential solutions, how do you strategize? Are there certain strategies that you see are key to help you speed up clinical trials, and what aspects would you focus on?
So I think, like I mentioned before, speed to startup, incentives aligning to understand how we can drive the people problem. It's not a people problem, just the people in general need to be directed down a path where they're not dinged for trying something new. Because let's be honest, the way things are happening now, it's not great. And so you need to try something different, and you need to be rewarded in some way for trying something different, but definitely not penalized if it goes wrong, right? Because it should be, you should try to create a safe space to try new things. Now, of course, again, think about how pharma thinks. These drug programs have been going on for many years, could be 6-8 years, cost them billions of dollars to get to this point. Imagine you're in clinical development. You're the one who's been here on this asset development for the past 5 years. We have another 3 years to go into phase 3 and through approval. Your entire reason for being is to get this thing on the market, right? The last thing you want to do is try and jeopardize that. So I understand how they think, which is why the idea of innovation and applying these new techniques and trying out new technology, it's really, pharma doesn't want to revolutionize and crazy disrupt everything and rip it apart. They just need incremental innovations. Yeah. It's a little bit better than what it was before, which gives them a speed impact. It gives them the incentive to do better, and it shows an ROI, especially now where things are tough, right? And it's a pattern, right? So think about, Stan, you've been there, right? Like 2002 crash, 2008 crash. All of these economic downturns also spike up a crazy digital transformation trend where IT groups are putting aside 10, 20, $50 million for transformation, and companies that are ready to scale for that opportunity end up getting huge. Yeah. And it's happening again. And so all of these companies if you're ready to scale now, if you're an entrepreneur, if you're a startup, if you're a mid-size, even a bigger company that can innovate to do something new, this is the time where everyone is reorganizing. Yes, pharma's laying off a lot of great people. They're reorganizing, they're re-strategizing. And since this AI thing is probably the biggest stepwise innovation, maybe since the iPhone, in a way, and in the way it will affect marketplaces and a whole ecosystem around it, there will be a huge amount of benefit for those that can capture it at the right way, because pharma, again, needs to do more with less, needs to optimize their process, and just be better than what they were with less money and less people. So huge opportunity for this stuff.
Yeah, and I think that embedded in that is kind of a key call to action or barriers that you see in terms of how to optimize. And I think your point on incrementality is important as well, because given all of the tools and different ways to strategize, if you're tackling it in an incremental way, you can actually see what's really working, and instead of getting have all confounding variables and try to figure out, well, which strategy kind of works best.
Yeah, and I think we're going to tap into a lot more of a healthcare enterprise as we bring research and healthcare closer together. If there's anything I can say to folks on this call that are or in this symposium that are very much involved in the healthcare space and digital health, the accessibility of health data through EHRs and through exchanges and through various means is becoming easier. There are new standards that are being put in place. There are initiatives right now between HL7 and the research community that are opening up more data with the consent of patients, of course, to share. But look for a project called Project Vulcan, which is HL7's way to make the FHIR resources more research native. They understand what protocols mean. They understand what the schedule of activities, procedures to be done in a protocol of a clinical trial and how it links to healthcare, especially in situations when you're in a hospital and you're prescribing clinical trials as a care option. This is huge to sort of just make it the natural next stage in the continuum, and opens up that data to not only find patients that are eligible for those trials, but then return the data back to them at the end and in their journey. So this is a big deal.
And that really speaks to your ROI, but also value-based care, and really what goes back to the patient for actually engaging in the trial. Incredible insights, Joe. Thank you so much. It's been a pleasure to have you on and sharing this wealth of information, and also some new aspects to think about. So thank you so much.
Thank you.
Stan, back to you.
Super interview. Wonderful insights there, Joe. Amazing. Really great to hear what's happening on the inside of the inside. And no one knows it more than Joe. Again, decades of experience in clinical trials, life sciences, particularly in the New York metro area, where no matter where you turn, you're running into a manufacturer or an academic medical center. We've got hundreds of them all over the place here. So it's great to see that. Also, if you want to meet more people, like Zena, who is a global fellow with Breakthrough One, or Joe, who likes to come and drink with Breakthrough One people all the time at our in-person cocktail hours, join here. Scan the little scan me button at the bottom right-hand side of the slide there with your cell phone, and not only accelerate your networking, but also go join HITLAB Hub, our platform where you see hundreds of transcripts and slide decks from all of our events over the last several years now, and get tons of industry insight and expand your overall brand and your influence in terms of being able to understand how to make good decisions in digital health. And the next step, we're really excited to continue the conversation around digital health evidence. Again, as the leading digital health evidence lab in the world, we're happy to bring back Riley Fink from HITLAB Advisory Services, and the CTO of Babbly, Carla Bentaval, who has just recently done a study with HITLAB. We just tested the Babbly platform, which she'll tell you more about. Handing the virtual podium over to Riley and Carla. Hello.
Thank you, Stan. Well, I'm excited to kick off our third hour here, and just want to start by saying a huge thank you to all the speakers from the first 2 hours. Some really excellent discussions, really amazing talks, and I know they will continue in the third hour, started here with Carla, as Stan introduced. And so Carla, thanks for being here, and please give a little bit more of an introduction to yourself.
Yeah, so I'm the CTO and co-founder of Babbly. We have developed a platform to monitor language development and help parents get recommendations into how to encourage healthy language development, and also how to understand what could be the red flags in terms of development.
That's amazing. And Stan, described a study that you did with HITLAB. So can you just provide an overview of the key findings from this new study on infant development?
Mm-hmm. Yeah, so before that, let me tell you that the reason why those findings are important, right? So 1 in every 5 children is at risk of speech and language disorders. And some of them will end up having developmental delays or disorders. but monitoring language development is not easy when on the early ages when there's no words yet, right? If you're not an expert, which most parents aren't, obviously, and even pediatricians don't really have the time to monitor these insights during the visits because they have to monitor all the other developmental aspects, right? So while it's very well known and researched that all the infants develop language following the same milestones, like from birth to when they start speaking, there's the same milestones regardless of language or cultural location. While that's well known, identifying them and knowing that if they're happening on time or if it's a red flag or is something worth waiting, that's the hard part, right? So that's what the study is about. We developed an AI to identify those milestones. And the key result, to answer your question now, the key result is that the accuracy in identifying those key milestones is 91% with just 2 to 4 audio recordings of infants from 30 seconds to 1 minute. And some of those milestones are, for example, canonical babbling. It's been related to a higher likelihood, the lack of or delay of canonical babbling relates to a higher likelihood of developmental disorders. So being able to identify that with 91% accuracy makes it a powerful tool for tracking.
Yeah, thank you so much for sharing kind of that inspiration as to behind why this study was, this very important study was performed. And you mentioned that you utilized AI, and you also mentioned that, there were 30 seconds or 1 minute audio clips. How were they further assessed, or what was the process in kind of just assessing those developmental milestones further to produce those outcomes you mentioned?
Mm-hmm. So yeah, HITLAB hired up to 5 independent SLPs, speech language pathologists, and each audio was analyzed by 3 of them independently, assessing which were the milestones that they as experts hear in those audios.
Okay, amazing. And then what were some of the challenges that the research team faced while conducting this study, and how did they kind of overcome some of those challenges?
Mm-hmm. Well, I think first challenge is always recruitment. I guess that's a known thing. It's not easy to recruit. We're recruiting babies, basically infants of a very young age. It is true that it was all remote and they didn't need to go into the lab, but it's not always easy to find like those families that have so many other things to do around. And the second one was to finding experts to identify those milestones. Like we said, like not everyone, we couldn't hire just like regular annotators. Not everyone can really hear like with so much detail like what's going on, right? So yeah, with the help of HITLAB, we hired the correct people.
Well, absolutely. I know the HITLAB was very excited to help overcome some of those challenges. And how can other people, involved in individuals and organizations find the full details of these studies and learn more about its outcomes? Or where can they go to connect with you and learn more about this study?
Yeah, we published a white paper of the study in our website, which is babbly.co, babbly.co. And it's in our blog, and we put all the details in there, including like all the references.
Amazing, thank you. And what do you see as the next step? How can this research be used to launch into the next phase, or what are the plans for future development of the outcomes that you learned from this study?
Mm-hmm. Well, next step for us is going into diagnosis, right? Now we know that we're able to detect those very important milestones. Now, how can we accurately say this is the right time for an intervention, or this is the right time to maybe get like a second, like a full assessment on language development or all that, to act early, because right now those things happen usually very late, and like language disorders are usually diagnosed after 1 or 2 years of age, and we want to bring them down to 9 months.
That's amazing. Thank you for sharing that. And if people want to connect with you on LinkedIn or any other versions of symposiums or summits or talks coming up on your end, or what's in the future for you specifically?
Well, we don't have any symposiums at the moment, but yeah, I'll share my LinkedIn in the chat and I'll publish anything. But yeah, our work is gonna be continuing into language development and going into diagnosis.
That's amazing. Well, thank you very much for sharing everything. I hope that you engage with HITLAB again in the future. We really appreciate partners such as yourself and some of the various speakers that have engaged with us today. And so hopefully that through working with HITLAB, you will be able to produce those results and share them and take those next step for you all. And again, thank you so much. Have you ever given a talk on a Women's Health Tech Wednesday at HITLAB?
No, I haven't.
All right. Well, I certainly think there's something in the future for you to continue to, provide access to a podium where you can share all the amazing work that you're doing at Babbly. And we really appreciate you coming on and sharing everything with us today.
Thank you. It's a pleasure to be here. Thank you.
All right. Back to you, Stan.
Thank you, Riley. And we'll also add to your title now, Women's Health Tech Wednesday Recruitment Coordinator. So you can have a little bit more to do since you're not obviously busy enough at the lab. But wonderful interview and really appreciate the tremendous work by the Babbly team. Would recommend, again, their LinkedIn is there. Go ahead and connect with them. Would highly recommend if you're anyone who's working in the pediatric area or wants to find other ways to work in voice-enabled tech and AI, their platform is really revolutionary and truly a talented and brilliant group of data scientists working out of Toronto to build a phenomenal product. And again, more companies like this, which again, remember, Babbly came through the Breakthrough Alliance and was referred through that. And this is where companies, again, without any equity, et cetera, are able to be proven and validated and verified through HITLAB's 37 different types of techniques and methodologies that we use, all of which are frameworks that have been validated by the NIH and other major leading institutions and used hundreds of times by scientists over the last several decades. So none of these are frameworks that we're building on an ad hoc basis and implementing. These are all well-proven scientific frameworks to prove this out. So again, join the Breakthrough Analysis, join the Breakthrough Alliance, and certainly become a BT1 member. Would be great to have you on board. And again, as we move into the second half of the third hour of this month's symposium, we're really happy to have with us someone from one of the biggest health systems in the country, Providence Healthcare, coming out of the Northwest. For those of you who don't know, they cross 15 different states. They have millions of patients and literally thousands of beds that they cover. And we're excited to have Ruth Krystopski here, and she's going to be talking about balancing data quantity with data quality in healthcare decision-making. And again, our own Ainsley Bowen will be leading this interview. Ainsley.
Thank you, Stan. And it's my pleasure to bring on Ruth. Thank you so much, Ruth, for your time today. And if you could start off by giving the audience an introduction to yourself.
Good afternoon, Ainsley. So nice to see you again. I'm Ruth Krystopolsky. I've had the wonderful opportunity and have been blessed to work in healthcare for more than 30 years. Primarily at the intersection of where healthcare is financed and where it's delivered. And I've had the chance to lead and grow teams that have used data and information to improve the value and outcomes of the patients and the communities that we've served in healthcare. I currently serve as the president of Ion Health Solutions at Providence Health, which is a purpose-built services and technology platform company, serving providers, health plans, payers, and other risk-bearing entities as they move forward on their journey and value in healthcare. So glad to be here.
Again, so glad to have you back. Ruth was previously on our Women's Health Tech Wednesday, so it's so glad to have you on the symposium. And getting right into it, how can organizations determine the optimal quantity of data needed without compromising on data quality for effective decision making?
Yeah, and as I've listened this morning to all of the other presenters that have talked about both data quantity and accessing data, as well as to quality, this is a really important question. And often we think, more is better. So let's get as much data as possible, and then we'll figure out what to do with it. But I think in the healthcare space, we need to think about better is better. So how do we set out at the beginning and answer and understand what are our objectives? Clearly define them. And then what is the most effective and efficient way to get the data that we need in order to complete the intervention that we're trying to do, or to answer the question that we're asking. And I'll give you an example. So I have had the wonderful opportunity to participate in multiple EHR implementations, going way, way back to the very first one that I did in 1999. And there was this belief that if we just hook all of the EHR data together and put it in one place, right, it would help us take better care of patients. And the reality is the cost and the complexity of doing that, while it's possible, is probably not as ROI producing as we need in healthcare. So I think starting with what objectives do we have? What data do we need in order to drive, the interaction that we need to have with the patient and our clinician, right, in real time, should be what we focus on when we're thinking about what we want to do with data quality over data quantity.
Absolutely. I mean, so how does that, having a well-defined problem statement, impact the success of data-related initiatives within an organization? Why is it important to start off with defining that problem from the beginning?
Right. The two hardest areas, I believe, in healthcare, particularly as you're delivering healthcare and paying for healthcare, is on the provider side and on the patient side, right? And so a strong data governance program, and that was mentioned by a number of folks early on, that clearly outline what your objectives are, that include voices across all of healthcare, right? Often I have the opportunity to talk to really, really smart people who are doing really, really cool things from the technology space that have never engaged a clinician, right? And don't understand the workflow and don't understand how the patient interacts with the physician, right? And so you end up in a place that that's not where you wanted to end. So I think, to be successful, you need a strong data governance program that includes a multitude of voices, and then a roadmap that is very clear on where you want to go, and you need to revisit it often, right? Often we put data governance programs in place, we develop a roadmap, and then no one looks at it, and 24 months later, you've kind of veered off the path. And so revisiting the roadmap to ensure that you're moving in the direction that you thought you wanted to move in is really important.
No, absolutely. And that's good to point that out, because definitely I feel like we either set goals for ourselves, just in general and personal and work, and then don't really revisit that later. And so we don't really accomplish much. So it's definitely important to, like you said, plan it out and then revisit it consistently to make sure you're still on the right track. And going kind of more back to the topics of the quantity versus the quality of data, what do you think are the potential downsides of organizations solely focusing on just increasing the quantity of data without really paying attention to the data quality?
Well, I mean, we heard from several of the speakers earlier today. The very first thing I think that's in jeopardy when we're focusing on quantity versus quality is the potential impact on trust, right? Mm-hmm. Trust by the clinician or trust by a patient when the data points us in the wrong direction or suggests a next step that's not correct. And so, and that trust is hard to gain in the first place, and it's even more difficult to rebuild. So I would say that first and foremost, trust is an output of good data quality, and building trust is an output of good data quality. I also think if we're just really practical and we start to think about the cost, so the acquisition cost of data, the keeping cost and storing cost of data, as well as the cleansing cost of large areas of data are hugely impactful, right? And so we need to think about that. The final kind of point is also the risk of having lots of data that we don't need, that we can't use, right? We're talking about people's personal and private information, including, sensitive information about their interactions with healthcare. And so I think we need to be extremely thoughtful as we're, gathering emerging large data sets and ensuring that we're protecting, the privacy and the sensitivity of that data.
Absolutely. And I wanted to get your opinion on this because, we have a large part of our audience is startups, specifically within the digital health, community. So how do innovative startups that have these promising solutions, they often sometimes struggle to seamlessly integrate into an established ecosystem within industries like healthcare. So how can they eliminate that struggle and be able to more seamlessly integrate within the current existing healthcare ecosystem?
Yeah, I think the incumbents in the current health IT ecosystem are extremely embedded and not necessarily always as inviting to some of the really thoughtful and innovative additional technologies that are out there. And so I usually, as I'm talking to startup organizations, I usually point to 3 areas, right? One is you need to understand the difference between the person who's using the technology and who's paying for it. Usually, many times in healthcare, that's not the same. And so understanding kind of the financial construct in which you're working is really important, right? To build your business case and to promote a business case to the healthcare entity that you're talking to. I think the second really is the political and the change management environment. Healthcare is extremely slow to change. I scare myself sometimes when I think back over the last 3 decades on where I thought we would be and kind of where we are. But the political and the change environment's really important to understand. And then finally, the regulatory compliance and other kind of, more structured framework is very different than other industries. So making sure that you understand both regulatory and legal complexity in healthcare is important for a startup. The final thing I would say is also, how do you fit in, right? The workflow for the clinician and how do you engage the patient is really important. I was listening to something and, we've spent billions of dollars on digitizing healthcare data, over the last 3 decades. And yet we're less productive and we have clinical teams who are burnt out from the work that they're doing, which I do believe some of the technology that we're using has added to. And we have patients who are really confused by what we provide them because it's not cohesive from a user experience standpoint. And so, I think thinking through that more larger ecosystem lens is vitally important as we move forward.
No, absolutely. And thank you so much for sharing not only your valuable insights, but also your experience with us today, Ruth. Thank you again for your time. And I look forward to talking to you more in the future.
Great. Thank you so very much. Have a great day.
Thank you. All right. And back to you, Stan.
Thank you, Ainsley. And thank you, Ruth. Just a tremendous interview. And again, it's an absolute honor to have someone from one of the largest hospital systems in America, if not the largest, depending on how you count, to share some of those really nuanced and detailed insights on what's happening within hospitals around this and how burnout is such a big issue. I think it's interesting that Ruth brought up the burnout that clinical investigators are facing, because it really is touching all aspects of healthcare and frankly all aspects of society. But healthcare, clinical medicine, and research in medicine has been affected tremendously by this because of what we've seen happen with the pandemic, the post-pandemic, and just everything going on with the price pressures within hospital systems, certainly around that area. And again, I think we're happy to continue talking about this. We'd love to have you join us at the summit coming up the week after Thanksgiving. If you have any questions or comments or topics, speakers, technologies that you'd like to see either in future symposia or at the summit, message me on the LinkedIn link I just sent to you on the chat box in the webinar chat room within the Zoom meeting here, and happy to talk to you more thoroughly and more thoughtfully around those ideas. We're just winding down the last half hour of the September symposium, and it's great to have investors come on this program. One of the ecosystem stakeholders that really do lead the charge when it comes to adopting new technologies are investors. And certainly Tau Ventures is one of the tops when you think of digital health investing. And Sharon has been out there doing this for a long time. And HITLAB's own Jerry Antimano is here to interview Sharon and hear more about how Tau Ventures and their portfolio of companies is unlocking the power of data and AI in healthcare today. Jerry.
Thanks so much, Stan. Really awesome to have you on the program, Sharon, and good to connect with you again. It's a real pleasure to have you with us to share your insights with the audience. But for those that don't know you in the audience, I'm sure they'd love to know who you are, what you do, and where you're calling from.
Sure, Jerry, Stan, thanks for having me. Really great to see everyone here, and really great to see invigorated New York digital health ecosystem that you guys have brought on. Just a quick background on Tau. We are an AI first fund, meaning we invest in really early stage AI in healthcare and enterprise companies. We come in primarily in around a 500K check, just really wanting to be partners around people building significant and AI levered tools within these ecosystems in healthcare and broadly enterprise in general. And then a little bit about myself, came from a computer science background, also in medicine, and worked as a software engineer before moving over to the investing side. So really excited about this space, honestly.
Yeah, no, wonderful to have you on, Sharon. And because you've had that experience of working with and looking at different technologies that are looking for that kind of funding and that investment, we'd love to hear some real world examples of successful applications of AI in healthcare settings that you've seen recently.
Sure. I mean, I think with the boom of ChatGPT and generative AI, there's just been kind of a really big increase in a lot of people building AI tools in healthcare specifically, but just in general as well. We started the firm in 2019 and kind of just seen like a really big movement towards investing in kind of AI tools. So to give you a couple of examples, I'll bucket it in 3 different categories. The first being applications in clinical practice and clinical workflow. So we see companies like Abridge being part of the clinician workflow when they talk to patients. And also companies like Iterative Health, where they're leveraging AI for computer vision to detect polyps and cancer early. So in that space, a lot of AI is used. You hear about AI in radiology and pathology, as well as AI kind of integrated within the interactions between patients and clinicians. And then I think on the second bucket, you'll see a little more. We're beginning to see a lot of companies kind of really in the back end of healthcare. So looking at things that patients don't usually see, like billing or insurance payouts, claims, reimbursements. To be honest, a lot of these kind of workflows in what we call the back end of healthcare is really exciting to us. And I think ChatGPT and large language models in general has unlocked a lot of these kind of paperwork workflows to be automated. And so that's somewhere that we've made investments in. Companies such as Alafia Health, Gludian, and the like have all fall within the coding billing space. And then the third space in general is kind of tech-enabled care. So we see a lot of AI in mental health AI in chronic care management. Those are really broad spaces that, you know, large language models can come in to a second and third order kind of application manner, can be really, really impactful. So I'll give an example. This is not a company I've seen, but I've seen a lot of young founders trying to build in this space. So as kind of companionship algorithms come out and get pushed out, of course, there's a lot of ethical concerns that come along with it. But we're beginning to see that that's not, you know, the first application that people think of when they see Gen AI in healthcare. But that's definitely something up there that, you know, is a really big application and might be in the future.
Yeah, no, absolutely. Yeah, thanks for breaking it down like that. Really good. It's really good to be able to sort of get those, get that insight in those sort of three sort of categories to sort of be able to get a good idea of sort of where these applications are at the minute. We have a couple of startups and investors as well in the audience, and I'm sure they would love to hear from your point of view. What are the current sort of key trends and the emerging technologies in the field of AI at the moment, and data analytics, of course, with this being a Bridging the Information Data Gap symposium. Give us some thoughts around that and where these emerging techs and data analytic pieces are going in healthcare in a minute.
Yeah, we're starting to see a lot of less of point solutions and a lot of more integrated both vertically and horizontally integrated solutions within healthcare. I think when you think back into, the early 2010s or even like 2015 and a little bit onwards, see a lot of point of care solutions where there's an app, for example, and you take a picture by the bedside and it tells you what skin disease it is. But nowadays you see a lot more companies willing to are able to work with health systems or payers, large payers, or even large pharma to be more integrated within their workflow. I think this is partly an attitude change from these large systems. I mean, we just heard from one, and also just started being able to have the technology and lever it to take more risks and to take on more within the healthcare ecosystem. And so I think in broad strokes, that's kind of what we're seeing. And, I'll give kind of a couple of examples of spaces that we're seeing this. One space that we see is just in cardiology. Within the tech-enabled care model, you see a lot of companies building not only upstream when the patients see the providers, but also downstream once they leave the hospital and maybe have to do at-home care, therapeutic movements and things like that. They're also being taken care of through technology and by technology as well. So that's just one example, but there's plenty of spaces within things like chronic diseases that are big killers in the US, like cardiology, like cancer, that we're beginning to see kind of tech really being able to be leveraged to help patients.
No, absolutely, and thanks for giving us those examples. If you folks in the audience want to hear, a little bit more around key trends in emerging tech, that Sharon's come across, please do connect with her, via her LinkedIn in the chat. And just to wrap up, Sharon, I know we only have 1 minute left, but we heard earlier around how healthcare professionals are sort of coping with some of the strains that they're going through on a daily basis. Just to sort of close us off here, we'd love to know how can healthcare professionals be trained and prepared to work effectively with AI systems, in their daily work that they're doing right now?
Yeah, I think that I see my colleagues around me, and I think it's just a matter of being familiar. Professionals and providers are trained in a certain way, and everyone goes through so much training that I think on the other end it's hard to you hear the saying of like, doctors don't want extra clicks, no matter how efficient or beautiful the UI UX is. If you make an EHR system, for example, that includes one extra click, they're much less likely to use it. So I think on the provider side is just kind of getting used to it, used to tech, and being open to it. I think in general, it's more of a culture and attitude change, but also being practical and knowing when to use it and when not to rely on it. I think that's one of those conversations that are going to be continuous out there in the near future as kind of AI is being pushed into the hospital in the future. Yeah.
Yeah, absolutely. It's going to be interesting to see where that all goes. Well, Sharon, thanks so much for coming on. I know our time was limited, but we really appreciate you coming on and giving your insights to the audience, and we hope to have you back on again.
Great. Thank you so much for having me. Have a good day.
Thanks, Sharon. You too. All right, Stan, back to you.
That's fantastic. What a great interview. Again, I think part of the reason why people from all over the world tune into this symposium each month is to understand the varied and detailed perspectives of all of the different stakeholders in the ecosystem that it takes to actually build a digital health company and make sure that these digital technologies are improving and helping accessibility for healthcare and other medications, et cetera, services in the ecosystem globally. And Sharon just provided a critical aspect of that, which is the venture community and understanding what they're looking for, how they identify, how they evaluate, and how they partner. So just a tremendous interview there. Thank you, Jerry. And don't forget that a part of this ecosystem are the startups itself. Again, we no one has a seed round company or an A round company or a B round company without evidence. And HITLAB is doing dozens of studies every week on generating evidence for these startups and for these emerging technologies. Rapid studies generally finish within 30 to 90 days. And the call for applications for the Breakthrough Alliance challenges are exactly that. The prizes are studies and evidence generation techniques and methods that HITLAB has refined over the last 25 years. So it'd be great if you are a digital health startup, if you know of a digital health startup, if you have a brilliant idea. You don't even have to have a product. You can submit an idea, and we judge ideas as we judge anything else. If it's highly innovative, then the lack of commercialization or product makes up for that. So all it takes is a tweet-sized entry and hit enter, and we will be following up with you on that right away. The call for applications is through October 20th. So you have a little more than about 3 weeks now. So do make sure that get the word out and get those applications in. And our next guest today is Robert Rodriguez, a healthcare veteran. This is someone who's been around healthcare since finishing off his undergraduate degree at Manhattan College and getting into back in the early 90s, one of the most prestigious health benefits and consulting firms out there, Quasha-Lipton, which I was just starting out as junior faculty at Quinnipiac University. Quasha-Lipton was one of those groups that had extraordinary expertise, and a lot of folks were talking to them about what benefits meant and what compensation and different types of structures for different kinds of healthcare benefits look like. And with Clinton Care in '92, Quasha-Lipton was really one of the folks that knew the most about how to do that. And so, Robert, it's great to have you on the program today. Why don't you start off by giving everyone a little bit of your background?
Good afternoon. Well, that certainly was a very early part of my career. Subsequent to that, I went to graduate school, did some big corporate jobs, but became an entrepreneur in long time ago, 2004. So I got actually into the care space through basically operating and owning urgent care centers. So been doing this for about 20 years on the ground, boots on the ground, working with patients and doctors and everybody else that's involved in the care cycle.
And, obviously, we're really excited to be working with you. You just recently sponsored a study with the lab that we're kicking off, an IRB approved study to better understand your platform from 3 different angles: patient, physician, and whatnot. So I think the idea would be to start off with just giving the audience a little bit of an idea of what Helix VM does and how you guys work within the ecosystem.
Okay. Helix VM is a marketplace platform that is looking to bring together referral sources, patients, and providers together to create as close as possible to an e-commerce transaction for the provisioning of medicine. So, the example would be, I'm sick, I need something, how quickly can I get it? And so our goal is to try to be able to do all of that as quickly as humanly possible, hopefully under 2 hours, from beginning to end. The model works really, really well in what they, moderate complexity to low complexity patients, who have, fairly limited needs. It's not for cancer care, for example. So, so the marketplace is something that we've been working on for a couple of years. And what underpins it, and which is extremely important, is the ability not just to bring in patient data, but also to organize that data using AI and using RPAs in order to put the information into the doctor's chart, essentially as if they were reading a finished chart, okay? And that's extremely important because in order for you to really be able to deliver care quickly, you have to be able to manufacture, not to solicit, manufacture, put together and assemble data for the physician so that way they can quickly move through a chart in order to give the patient care quickly.
Okay, so that makes so much sense. Why is there a need to bridge the data and the information gap in the healthcare industry? Where's that coming from? You've been at this now for almost 30 years. What's your perception there?
Well, just to give you an example for that is, we have an AI. We basically put together notes for physicians, in essence, for them to read. And one of the things they always come back with is sometimes there's way too much here. Okay, and so the issue isn't just gathering data for the physicians; it's also filtering that. What is it that they really need to do, or what is it they really need to know in order to address this specific concern? And so that's not just a mix of subjective data that you capture from the patient as they're working on the platform, but it's also third-party data sources that are validated to make sure that you're giving them a snapshot of prescription history, giving them a snapshot, of ICD codes from the past. So that way the physician can work very, very quickly to say, okay, I think I know what this patient wants. I understand what they're telling me, but I also have some objective data, because the reality is that you don't always get the best information from the patient. And sometimes the patient doesn't exactly tell you what they want, or they don't sort of lead you, provide the information as accurately as you want. So the ability to bring in subjective, objective into the model, into our software, be able to process it with AI, and then be able to put a note in front of the physician is really impactful. I mean, the hardest thing that we have once you do that, frankly, is still paring down the data and also getting the physician to actually read, because they're so accustomed to just doing that themselves with the patient. And what we're asking them is to just read it, take 60 seconds and read. Because if you read, it'll really, really speed up the amount of time, the applied time you spend with the patient.
Yeah, I think that's exactly right. And that patient experience is so important, and speeding up that time is so critical. How does Helix VM contribute to making healthcare more patient-centric on top of that?
Well, the patient centricity for us is really focused on the access question, which is how quickly can we get you care? And I think that that's very important. You see it in a lot of different aspects of medicine, like you go into the weight loss, you go into, folks who are basically their prescriptions running low and they can't get in to see their physician. These individuals are looking for very fast access. They're looking for answers. Many times they already know the answer they want before they even show up in your office. And so the ability to still practice medicine without, having kind of a Burger King mentality of having it your way is really important. And so that's what we're looking to basically do for that patient, is to provide that sort of as close to e-commerce type of experience where they can start and end in very short time windows, as opposed to start and end over, a week or two, right? Hey, I need to see the doctor, but I got to wait a week, and then I've got to wait, 2 days to get a prescription. Those types of delays are what we're trying to collapse and condense.
That's brilliant. And we've got a question coming in from the audience. Is this platform agnostic, and is this for non-acute, PCP, or other non-inpatient providers?
Okay, it is. We're agnostic. Our approach is basically we will be an omni-channel input. So anybody who wants to even create a booking on our system, you can create it directly through a third party. We can pull it off the doctor scheduler if they want, in order to convert that patient into basically a note for the doctor. And so from our perspective, we don't care. In terms of what we're focused on right now, it's really going to be moderate complexity with a mixture of episodic medicine as well as also chronic care. But I think once you get past the patient who's got 3-4 chronic care ICDs, we're probably, the analytical model and the software that we have is probably not where we would like to get care. In that case, I think you probably would move it into a more office-based environment where the physician really needs to poke and prod the patient and spend a little bit more time with them.
That makes a lot of sense. And so, again, great questions from the audience. And Angelique, thank you for submitting that. And any other questions, people, please do, just go onto the Q&A section or LinkedIn or whatever you can do, and let's get them in here. One of the other things that we were wondering when we were going through this is if you can talk a little bit more about the role of collaborative care and why Helix VM's approach is so important to that.
Okay, so the collaborative care question is not just about, it's about as much care as it is also service in our model. So for example, when we talk about our booking platform and our triage clearinghouse platform, what we're talking about here is a way by which if you are a patient walking into an office and there's a specific need that exists because there's an employer who wants something from you, there's a pharmacy who's looking to get basically maybe give you a prescription. They have different data requirements that you have to report back to them. Well, the ability to basically get those data requirements before the patient is being seen not only increases the probability that the provider can satisfy those data needs at the point of service, but it also speeds up the care. I think anybody who's worked in a medical practice understands the story of the patient coming in and then 2 days later, they need 5 different things sent back to them because the pharmacy needs this, because the insurance company needs that. We're trying to basically put that all together on the upfront because the ability to understand the data requirements the patient has when the order in essence is created is extremely important in efficiently addressing the data that you have to get, where it goes, and who has to sign off on it, which in this case, it's a physician at the end of the visit.
Okay, this is great. Again, very exciting. And for the audience, stay tuned for more updates on this amazing platform. If you guys are wondering what this is going to turn into, go ahead and Google covermymeds.com and check out how they got in the patient centricity mix and look at their entry point, look at their exit point, look at their management team, their technology platform. We're very excited about this, and we see this as a very similar type of platform that's coming our way. So again, Robert, thanks for joining us today, and looking forward to seeing you on future programs.
Absolutely. Thank you very much.
And so we are in the final 10 minutes of the September Symposium, and really excited to have, again, HITLAB's own Riley Fink, the Innovation Strategy Manager at HITLAB Advisory Services, talk to Mark Apjes from Deliberate AI, a Breakthrough Alliance winner from last semester, and handing over the virtual podium to Mark and to Riley.
Okay, it is my pleasure to introduce Mark, the founder and CEO of Deliberate AI. Hi, Mark. Good to see you. We're happy to have you back and share a little bit more about Deliberate AI. So let's start there. Go ahead and please introduce yourself and Deliberate AI to the audience.
Yes, thanks, Riley. And it's a pleasure to be with all of you. I'm Mark Apjes, founder and CEO of Deliberate AI. What we do is we aim to make mental health care more objective. So one of the challenges we see is that diagnosis and outcome measurement is quite subjective in mental health. And we're using more objective technologies to do that. And the way we've started is using audio-visual signals from telemedicine or Zoom calls like this one. And we extract from that a kind of a variety of signals, from vocal acoustics to the way people move their face, head movement. And we correlate those to mental health conditions so that we can better diagnose and track outcomes.
And speaking to some of those technologies, as you just described, in telemedicine, what are the ways in which the challenges with patient self-reporting, as you mentioned, you're using technology and there's unfrequency and unreliability in self-reporting. So what does deliberate AI do to overcome those challenges?
Yeah, so I think that's one of the key reasons why we got started. Like, one of the challenges is that only kind of 1 in 3 clinicians actually routinely kind of checks on symptoms, use routine outcome measurement tools with their patients. And even if they do, only 1 in 3 patients actually fills them in consistently. So one of the big challenges that we first of all have is that there's a huge kind of missing data problem where we don't really kind of know what's going on. And then secondly, self-report has the kind of the downside is that kind of a lot of the things that self-report measures ask patients to reflect on are especially those things that they're in treatment for. So their ability to accurately reflect on how they're feeling, how they're doing is sometimes hard. So kind of that's where kind of by us kind of being in the background, we can kind of measure these symptoms and give kind of more objective reading without kind of putting any additional burden on patients or clinicians. And so we're doing that with kind of things like depression, anxiety, and we kind of predict kind of the routine skills there. We're also now moving into some exciting work we're doing with DARPA around suicide prediction. So not only how do we measure outcomes, but also how do we start predicting risk using more objective signals that are often missed by clinicians.
Absolutely. So, you're utilizing technology to take something that is subjective in nature and making it more objective through all the technology that you have. So how can that be taken to payers in order to get them to adopt the deliberate AI algorithms around your collection of that reliable data to improve decision-making and outcomes?
So our initial target has been both clinicians, kind of healthcare providers, where we're kind of helping them not just kind of measure outcomes, but also kind of using the same technologies to improve workflow by kind of summarizing what's actually being said, helping them with the clinical notes, so kind of some of the low-hanging fruit. And the other use case that we have is in clinical trials. Now, what we're starting to do, where kind of in clinical trials, we're trying to more accurately assess kind of treatment response. Now, with payers, one of the things that we're seeing is there's a growing desire for payers to start getting more focus on getting good outcome tracking of what are these treatments actually delivering me. And it's not just kind of the large insurance companies, but also self-insured kind of corporates that are spending a lot of money on kind of say mental health care treatments with uncertain outcomes. So we've had a kind of a wave where there's been a lot of focus on how do we get access, how do we get equitable access to mental health care. And we're expecting and we're seeing some movement to say, well, how do we better grasp what's working, what isn't working, and how do we have better data to actually track outcomes and understand what's driving those? So we're seeing that going up, and I think kind of there is a self-drive within payers now that kind of utilization is growing up to make sure that that they have a better grasp of outcomes as well.
Yeah, absolutely, and that ties in, directly to value-based care. So again, getting paid for the positive outcome and not that typical fee-for-service model. So what are some of the things that you've seen just in the field of mental health and how it relates to value-based care? I know you've spoken to it a little bit about, making sure that you're having good, reliable, objective data. But can you just talk basically to, mental health care and how it relates to value-based care?
So I think we're starting to see some movements towards value-based kind of care contracts where providers are having these kind of contracts. They're kind of currently a lot of the outcome data that they're kind of providing or are being requested for by payers is quite basic.
One of the things you mentioned is, making sure that patients are getting good outcomes and adopting the value-based care model to where you're getting paid based on the outcomes and not the typical fee-for-service model. So in the realm of mental health and value-based care, what can you speak to on how advanced AI algorithms are going to play a role in to helping overcome some of those limitations of the, maybe subjective or unreliable data?
Yeah. So that's a great point. I think one of the things in mental health care is we've seen that it's a little bit behind value-based care compared to kind of other areas in healthcare. And where some of these contracts are taking place, like the kind of outcomes or agreements between providers and payers are typically based around kind of quite unsophisticated outcome tracking tools. So by kind of us and others providing more objective outcomes, kind of we can start kind of enabling that kind of transaction to be more rigorous. And then the next part is where AI can play a huge role. We've done some early early proofs of concept around this. Well, how do we use that to also kind of not just track outcomes, but also provide providers with insight on how to improve those outcomes? So I mentioned a little bit about suicide risk, which kind of we're doing some exciting work around. Another thing is, for instance, working alliance, a very specific element around kind of the relationship between, say, a therapist, a psychiatrist, and a patient. That's actually one of the biggest drivers of outcomes. Now, some of these things we can start making objective and providing this as feedback to clinicians so they can actually kind of use AI to not just kind of track outcomes, which is already helpful, but use that with additional insights to actually improve those outcomes as well.
That's amazing. Excellent.
Thank you very much, Mark,
for a wonderful conversation. Thanks for joining us.
Thanks.
And I'm going to pass it back to Stan.
That's just super. What a tremendous way to end a tremendous day. And again, thank you everybody for joining us today. Thank you, Mark, for that. Remember, call for applications for the Innovator Summit are going to wrap up in about a month, October 20th. So if you can, remember to enter your company. Don't forget to sign up for the symposium next month. October Symposium is just about a month away, 30 days away. So sign up and see Julie Kim from Takeda and Dr. Mohammed Babi from the United Nations and many others. And we'd love to have you join us for the Innovator Summit in person at Columbia University on November 28, 29, 30. So get your tickets now while we have them. We only have a few hundred seats, so it's going to be a small group gathering. And then don't forget to join Breakthrough One and get involved in amplifying your brand, accelerating your networking and your education and inspiration. And again, Women's Health Tech Wednesday, next Wednesday, we're looking forward to seeing you there and having more open chat box and more connection. And special thanks to all of our sponsors for today, Organon, Takeda, and Providence, and all the good groups that are out there. Certainly AARP, H-Tech Collaborative, CanView, IMC, Information Media Corporation, and all those good folks. Huge thanks to our tremendous team who puts this all together. Rachel, Yamina, Ainsley, Raymond, and certainly Jerry. Thank you for joining us, everybody. Have a wonderful October, and we'll see you in about 30 days. Take care, everybody.